We're going to go ahead and get started. There was a second part to this that we just voted on, but this is just an update, so we asked you to bring this back to us, so let's go ahead and close this portion out. And so we're going to do the housing update now.
Okay. Again, good afternoon, Mayor, Vice Mayor, Commissioners. And so when we were at the workshop on January 28th, there were some questions that the board had, and we wanted to bring back responses. So the first one was with regards to single-family homes. Here's information in terms of median sales, its increase, days contracts have been on the market, and the same thing with townhomes, condos. Again, just some information to share with you regarding your questions on January 28th. Additionally, we looked at the rental market, and so Rent Cafe's information, question came up about the market rate units, and so 95%, what Rent Cafe has shared with us, so provided us 95% of occupancy rate on developments that are 50 units or more, with an average of 13 applicants to every vacant unit, and then the percentage of renters that are renewing their leases. Rent.com information with regards to how rental rates are trending. We'll see that rental rates in the city of West Palm Beach, for instance, is coming down a little bit, while the rental rates in the Boca market are increasing. Overall, countywide, rents were up 2.1% over last year. Interesting information with regards to income and a couple of our largest employers here in the county. With regards to the AMI being $104,000, the school district is the largest employer. 95% of their employees earn less than the AMI for the county. Similarly, 72% of the Board of County Commissioner employees earn less than the AMI. And as we discussed within the FIU study, 9 out of the top 10 occupations for employment growth in Palm Beach County is below the AMI figure for the county. Just a general update on housing bonds, and I know we'll be talking about this more over time. At this point, we have over 1,100 units that have been approved. The question was regarding the number of bedrooms in the units, and so there are 510 one-bedroom units, 472 two-bedroom units, and 136 three-bedroom units. With regards to the HED-assisted projects that are currently under development, the Board of County Commissioners has approved over $88 million for projects, 30 projects creating over 23, almost 2,400 units, including the new construction of just under 1,800 units. And then here's kind of a breakdown of rental units versus home ownership units. And it's generated over $655 million in total development activity, the board's contribution. Okay. Again, and just a 5-year look at what the board has approved through housing economic development, just under $148 million in projects. Just under 6,000 units completed or under construction. And that consists of not only new construction, it also consists of rehabilitation, acquisition, homebuyer assistance, and foreclosure prevention. And then with regards to the Housing Finance Authority, oftentimes they're overlooked, but we wanted to make sure we provided you information regarding the county's Housing Finance Authority, their new construction projects, the amount of bonds that have been issued, as well as the acquisition rehabilitation projects and the amount of bonds that have been issued there as well. And at this point, Sherry Howard is going to share a little bit about the housing dashboard. We talk a lot about the dashboard, but we just wanted to show and share just a little bit, and then we will move forward.
Good afternoon, Mayor and Commissioners. Sherry Howard.
Mic is not working.
HED. Can you hear me now? Okay, thank you. So we've talked a little bit about the countywide housing dashboard, and so that you know where this is accessible to you and our residents, it's right on the county's homepage, and there's a banner right at the top that you can click on. When you click on that banner, it brings you to a number of resources that are available to you and the residents. And where this came from was in 2022, there was a more concerted effort to put additional funding by the Board of County Commissioners into housing. And once we were doing that, County Administration and County Administrator Baker wanted to have something available to our residents so that residents could see where these were being created and what our partnerships were doing. So just to go down very briefly through these clicks, if you're a resident in Palm Beach County looking for workforce or affordable housing, you can click on this first tab. Oops. And you can see here how many projects are underway, how many units, and how many are affordable. Now, when we look at workforce housing projects, the workforce housing units that are demonstrated here are from 2006, since the beginning of the workforce housing program. But as we know, it's only been until recent years that we've really had a lot of activity there. And then again, in 2022, when more funding was put in place for affordable housing units, we started to show the units that were getting underway at that time. So a resident is able to go in here, sort by municipality or sort by commission district, and then find some information on each of the sites when you click on what you're looking for. So if you were looking in Delray Beach, and you wanted to look at Island Cove, which you can see here is completed, and it's an affordable type of housing, and there's 60 housing units there. When you click on the website, it will take you there. It tells you that you're going outside the county website, and then you can go and you can see the contact information for Island Cove, so that would help a resident there. When you go back to the dashboard, you can see that there's the progress report. And what this shows is what we are doing as far as the cities that are partnering with developers and with the county, and what, since 2022, on our affordable side, where we are as far as projects. You can also click at the bottom where it shows workforce units, and you can get additional information here, clicking on the website, etc. And you can get the combined units on the left, which shows the total. So there's a little bit more information here. You know, we always talk about what are the four fair market rents? What are our workforce housing prices? If you click on this, what can I afford? You can see here all of the different charts that demonstrate the programs and what the affordable rental units are. So you have all that information right at your fingertips. Then you see the rent, the multifamily income limits and rents, and those are for 10% increments of income levels, the workforce housing rent incomes, and the workforce housing sales price. We also put a handy little rent calculator in there, so if you want to say you want to hold to the 30% of your income, you put in your income and it'll calculate how much you can afford. If you want to go to 50%, you can do that as well. Then we have some other data in there with respect to income in Palm Beach County. We have household income by year, unemployment rate, average annual wage by industry, and annual average wage per year. The 2023 census has just come out, so these first two boxes will be updated, and they're up to date as much as we can have them up to date with the resources that we utilize for the data. Then also, when you look down at the supply, you can get additional information, representation of housing units, single-family housing price, rent index by year, and age of housing stock. We also have, and I think I skipped over one, additional affordable housing. This one was right under what can I afford. So what we did is we listed about 85 of the projects that we funded before 2022. So if you don't see something in those units that have been under development since 2022, you can look back here and you can see that their websites are made available to you. So there's additional information for residents out there to look for housing. And then we also have our housing programs, a link to community services housing programs, and planning, zoning, and building workforce housing. So everybody has that information available on one page. So thank you very much. It's just a brief overview, and if you have any questions, you can let us know. Thank you.
Great, thank you.
And then we're going to give it over to PZB to provide additional responses to the questions the board asked at the January workshop.
Good afternoon, Commissioners. At the workshop, there were several questions posed that were specifically about the workforce housing program or planning-related issues, and so we would want to address those now. I think the slides are on their way up. Here we go. All right, so one of the first questions posed was, are density increases occurring where it makes sense? So just generally speaking, as a concept, the comprehensive plan identifies the highest densities in the urban-suburban tier, which is where the full complement of services is available or is expected to be available over time. So from that perspective, that makes sense. In addition, there are a number of programs to further increase density that also apply only in the urban-suburban tier. You know them as the Workforce Housing Density Bonus, the TDR program, some of the provisions of the Westgate CRA, that kind of thing. And then finally, for places where the identified density or the density bonuses are not enough, the board also can consider comprehensive plan amendments several times a year, as you know, for potential increases to those land use designations. Next question was, does the county share workforce housing tools with municipalities? And the answer is yes. We do collaborate with the handful of communities that have similar programs here in the county, as well as with others around the state and the country that are contemplating setting up programs. We've served as a resource on a number of occasions for those. We compare notes on what's working, what isn't, that kind of thing, and when we come back to you at the end of February, it will be in part based on that sort of assessment. Another question that was posed was, does the county track the number of workforce housing units and bedrooms in those units? Yes, we track every single unit that is for rent or for sale, and we have to know the number of bedrooms in each workforce unit so that we can make sure that the correct rent is charged, because the rents are based on the number of bedrooms. I should say, though, that the program does not prescribe the number of bedrooms that have to be provided in a workforce unit. So that has always been up to the developer to determine what size of units will be provided. And how many workforce housing units have been developed and are in the pipeline? I won't go through the numbers in detail, but you can see the breakdown here. We have a significant number, about almost 1,800 units that have been developed to date. The majority of those are rentals, and those do include some exchanges that have occurred. Through the workforce housing option that allows one developer to pay another one to take on their workforce obligation. We do have 229 units that have been sold through the workforce program. We have another 1,300 units in the pipeline. Big chunk of those is in the Indian Trail Groves approval, which is not yet built, so just something to keep in mind. And then 331, or somewhere around 12% of the total number of units, have been addressed through in lieu fees paid to the county. And that money, as you know, is used in turn for down payment assistance for the purchase of workforce units. And a question was posed about whether density bonuses are provided for projects that are requesting bond funding from the county, and the answer is no. They are separate programs. As I mentioned, we do have other vehicles to increase density. The bond program is for the funding side. Not every project needs a density increase. Not every project that wants a density increase needs funding. And that is it. So I'd be happy to answer any questions on that as well.
Commissioner Woodward.
Thank you, Mayor, and thank you for this report. I just wanted to go back to page 3, where you had the rental market average rents according to rent.com. This is all rentals, like market rate. This isn't our numbers, right? Or as far as like workforce or affordable units, this is all apartment units?
Yes, ma'am, this is the market.
Okay, so if I'm reading this right, then for the West Palm Beach market, the 1-bedroom rate is decreased to $22.82, and the 2-bedroom is decreased to $26.08
Yes, ma'am,
for the city of West Palm Beach.
for the city of West Palm Beach.
All right, thank you. I'll come back to this on our next item. Thank you.
I see no other lights on, so I would like to thank you for your presentation. Oh, sure, sorry.
So going back to the slide 12, where we have 42 exchange units, are they actual units, or are they send it to, or paid that exchange fee or whatever? Is it actual units on the
There
ground
are
that were
four-
created, or it's actually they just went through that program?
No, those are units that are in place today, rented with tenants in them. Those represent a 1.5 multiplier, so whatever that represents, can't do the math real quick, but a developer had an obligation, they paid an exchange builder to take on that obligation, paid the exchange fee that you reference, and the exchange builder provided 1.5 times that obligation, which turned out to be 42 units in this particular project. We have other exchanges in the pipeline, but those 42 are in place.
So the exchange builder is obligated at 1.5?
In this particular case, because of a different provision in the code, that if a for-sale project wishes to meet its obligation with an off-site rental unit, a multiplier of 1.5 applies.
Okay, got it.
Yeah.
Okay, thank you.
Thank you. I see no more lights on, so thank you very much. We appreciate the follow-up. And now we're going to move to item 5E3.
Thank you, Mayor. Again, Jonathan Brown, Housing Economic Development. And today we're bringing back a request to the board. If you recall, when we met a few weeks ago, a couple months ago, we had a project for Marina Village. That particular project did not meet the housing bond requirements because it was going to be paired with sale funding. At that time, staff requested that the project be denied bond funding. The board said, bring that project back with a different funding source. And so today we're bringing that project back with a different funding source. Again, just some basic information about the project. The funding request is just over $4.7 million, which is just under 7% of the total cost of the project, with a period of affordability of 60 years. You'll see 119 of the units are county assisted, and we're looking at a county assistant per unit cost of just under $40,000. And so today we're bringing the project back, seeking the board's approval of the alternate funding source, as well as the denying of the housing bond funding source.
Thank you. I see no lights on. Up. Commissioner Woodward, Commissioner Flores, Vice Mayor Baxter.
Thank you. Sorry, that was quick. I was getting my stuff together. 1 second, divided. I had to remind myself of this and go back and look at the meeting because it was a while ago. And I remember we had some concerns. We talked a lot about hard costs and soft costs and payment terms. I think that they could wait till 20 years to pay. That has been fixed, right? The repayment happens at a year 11 or so. Where are we on this?
With the alternate funding source under the HIP dollars, the payment will be cash flow dependent, where the developer will have to show us on an annual basis what the cash flow is, and the payment would be calculated accordingly. We would still get paid by the end of the 20-year term, but because they also have sale funding from the state, they could not have a hard payment provision requiring them to make scheduled payments. It had to be cash flow dependent in order for them to receive the sale funds.
Well, a couple of questions since we had our workshop. And thank you. Commissioner Flores asked a lot of questions on sale that helped me learn about this process even more. And we had some public comment. And one gentleman spoke to the fact that in order to get sale funding, you have to have all your finances in order. And that was something that I myself wasn't aware of when we had this item brought to us a few months back, because as I recall, it was being explained to us that without this funding from the bond or HIP, they would lose the sale funding. So I'm trying to understand this process where if you have to have the money when you go to the state, what happened?
And great question, Commissioner. In some instances, the project costs have increased. And then that way they can come back to the county and seek out additional funds. In other instances, you may find that the county assistance is at a lower cost than the other funding that they may have had in the project.
Do we know what the case is on this project?
I don't, but the developer is here.
Could we have the developer answer, please?
Good afternoon, Albert Milo, President
You
Related
turn the
Urban.
mic on for that?
Are those on?
No, over there.
All right, try again.
Good afternoon, Mayor and Commissioners. Albert Milo, President Related Urban. I think the difference is that in some of these state programs, you have to have a local match in order to apply for the funding. That may be what you heard at the workshop. Now, as it relates to gap funding, typically the gap funding after you get your larger state award is the local money. So this is like the last leg of the financing.
So this wasn't a match?
Huh?
This wasn't your local match,
No, it
though?
wasn't. I'm saying in many state programs, you need a local match. This is our last piece of funding, along with our funding from the Riviera Beach CRA, our equity, and the county is the last piece. And this project, the reason it didn't fit the bond mold, if you recall, is because we weren't a full affordable, we weren't a full workforce, we're a hybrid. So we have units 30%, 50%, 60%, 80%, all the way up to 100, 110%.
Okay, so just so I understand it, that was there an increase in the cost of the project, and that's why you need the gap financing?
There were some, because we had a parking garage that had to address the parking requirements of the city on Marina Village, yes.
Okay, well, stay. I have one more question for you, because I went into the backup to pull up what the rents would be. Last time I asked you, what were these 1 bedrooms, 2 bedrooms, the sizes, and what was the breakdown in the affordabilities? Yep. And your breakdown has, which this is new information that I just got from your report here with the local market from West Palm Beach. You have 27 of your 1-bedroom units are at 110%, which is $22.09 is the rent. And what is this? 39 of the 2-bedroom units are $26.50, which is actually above market rate in West Palm Beach.
It's actually, the net rent is $2,064 for the 1-bedrooms and $2,470 for
So
the
you are
2-bedrooms.
taking into account the utilities?
Yeah.
Okay.
Because we have to credit back the utilities as part of the program, yeah.
So even so, this is, where is this located? This is in Riviera Beach,
This
correct?
is on Marina Village on the Riviera Beach on their waterfront, yes.
Okay, so my concern is with rents decreasing and that these numbers are tied to AMI, which doesn't follow the market. It follows our HUD numbers that we get every year. My concern is almost half of these units are market rate.
Well, they're established at the that's the highest you can charge rent. That doesn't mean that that's the rent we're gonna have to end up charging, but they are based on the county's chart at 110. minus the utility allowance. So, and as far as any tax abatement portion of those units, we would have to be even below that to get any type of tax incentive under any of the other programs. But at some point, when you get into underwriting, you have to set your AMIs. Originally, it was 120, and when we brought the board asked, hey, 110, so we dropped it to 110. So all this is showing is the maximum rent on a 110 is that minus utility allowances.
Okay, well, I asked for these the last time because we keep coming up with these where we're talking high AMIs, and I know financially we have to make a way to make this fit. I'm still just very concerned on these rents. I'm ready to let the rest of the board talk about it, but when I did ask you the last time, were they evenly distributed? And you said that they would be. And I know some of these, and you go into the 30, 50, 60, 80%, they're pretty evenly distributed, but it is very much top heavy at the 110 mark.
Well, we
And I'm
have
concerned.
90s, 100s. We have more than half the project is below that, between the 30s and the 80s and 90s.
And half your project is at market rate almost.
That's the mixed income approach, right? If not,
Yeah.
then you would need a lot more, dollars. That's why this is less than 7% of the total project cost. And again, we have incomes throughout all of that, all the different brackets. I don't think there's any project, at least not of the ones that came through the bond funds, that are only at $39,000 a unit and have that type of income diversity in a project.
I agree with you. I think it's just important that we highlight that this is a very difficult balance we're trying to strike here because we are using taxpayer money to subsidize units. And my concern is we're subsidizing them to get to market rate. And for us, I know it's not this, the formula is what the formula is, but it is concerning to me that this is the line we're having to draw. And I'd like to hear what the rest of the board has to say, but it is, we're almost at market rate at 110% AMI. Again, and this is something we've talked about, but when we talk percentages, that's one thing, but let's talk dollar amounts. $2,400 for a 2-bedroom unit, that's 915 square feet. So, thank you.
Thank you. Administrator Baker, you had your light on, then turned it off. You okay? Okay. Commissioner Flores.
Yeah, Commissioner Woodward, those are excellent questions. Thank you for making that point. This is one of these projects that when this project first came forward, there was a motion to deny, and I asked some questions because the numbers, at least on paper, they look very good. So we're going to provide about 6.97% of the total cost. The affordability period is 60 years. 149 units, which 119 are assisted because of the AMI. And, the county assistant per unit is around $39,500. So I do like this project. I know that we had to work through some obstacles, and I want to thank staff for working through that. But yeah, so it's, Mr. Milo, it's something that Commissioner Woodward brought up. If we can do better, we would always appreciate that. Sure. A lot of people are feeling it, but I believe that this is the kind of project that we want. I know that this is received a sale funding, which is really helps reduce the cost. But at the end of the day, we need more projects like this, and I'm excited that we're moving forward with this. Thank you.
Vice Mayor Baxter.
Thank you, Mayor. I too support this project. I will wait to hear from the district commissioner ultimately, but at the end of the day, overall, I like it. I like the mixed use of different things. I am concerned to Commissioner Woodward's point about providing, a lot of money to potentially be at market rate, but to your point, it is a mixed group, right?
Right.
Of affordable workforce and market rate housing. So, I'm sure it's hard to. I will also say that I dislike the idea that we provide all this money to get the lower affordable housing units in there and then still have a bunch to the large number of, market rate, but I'm sure you know your business better than we in the sense of how to make the numbers work. And at the end of the day, you also have to have an incentive to get this project done, and I'm assuming this helps with that.
Yeah, the higher paying units help subsidize the lower
lower.
income unit. That's why we're able to have that type of income diversity.
Right. And so I do appreciate you bringing this to us and putting it forward. I know that sometimes this process, it can be cumbersome. So thank you for working with us and bringing these units to the county.
No, thank you, and you know, to your point, and your staff has been excellent in working through this, you know, taking the feedback from the board since the first time it came, talking to us, going through it. So they've been very, very good in maneuvering through the process.
They are good at that, so thank you.
Commissioner Powell.
Thank you, Madam Mayor. Mr. Milo, question if, and I know this came before us a few months ago or a while back, and the request is for the 4.7 million, which was originally requested through the housing bond. If we had not amended the funding source to do the 4.7 million from the housing assistance plan or program, would that have stopped the project?
It would have stopped this level of affordability for sure, because the bond program had that hard pay component, which conflicted with sale.
Okay. And the percentage of assisted units from the county is 80%.
Yes, sir.
Following up on that, a concern, and Commissioner Woodward brought it up, that even though we're using the area median income, at 110%, those units still would be above market rate. Is that correct? A majority of the units?
No, actually, the market study that we have as part of the underwriting showed those rents higher than that there, but based on the chart that your staff just put off, yes. If you're using those figures, yes. But we do have, because we have to go through underwriting too. We're not gonna, no lender is gonna approve, the state won't approve it either. We have to go through that. We have a market study that's provided, so you have to document that you have a discount to rents, regardless of the AMI. If you set it at 80, just because you say it's 80 and the chart says X, you need to demonstrate that you can, you know, be at a market study and appraisal higher than that.
Thank you. I appreciate that. I see in the back up here, and I also know that we also have a provision in here that will be based on the lease in terms of rent increases. If the area median increase or if the HUD numbers change, those will not be impacted by the individual leaseholders or renters will not be impacted. At least they'll be able to go through their lease. Is that correct? And that's what you all have agreed to?
That is correct, and I think that's a good policy, you know, because there's been issues in projects that were, hey, we moved in 3 months ago. The AMI chart typically comes out April 1st, sometime in April, let's just say, typically April 1st. They might have just moved in, but I think that's a good public policy that you guys have adopted. Say, listen, their rent can't change until their lease expires, you know, and that's something that's in your term sheet and that we agreed to. Yes, sir.
Thank you. Do you anticipate, even after their leases expire, do you have a mechanism that will determine how much those rents can increase when their leases do change, or is that still going to be based on the HUD numbers?
It's based on the HUD numbers, but again, you know, if you have to know your market, right? So
Right.
If the HUD number goes up $50, $100, but your rent market can't support that, it doesn't make sense for a developer to try to go to the max all the time, you know?
Okay, got you. All right, I think that's my line of questioning, Madam Mayor.
Thank you. Commissioner Weiss.
Thank you. My question has to do on the repayment of the funds. So if the property were to change hands, would that trigger the repayment, or does it continue on?
If the property is to change hands in the bond allocation process, and I don't have it in front of Jeff, so quote me if I misquote it, if 50% or more of the
This is not
aggregate
a bond,
ownership
though.
changes, then our loan has to be repaid. The affordability period would continue, but if 50% or more of the aggregate ownership changes, then our bond has to be repaid.
Although this is not, we're not using bond money, right?
Right, but it'll follow it'll follow that same, because again, we based the HIP off of the bond, and projects that did not qualify for bond, we looked at the other source, so that would be the same.
In the past, we have received requests from the subsequent buyer to continue the terms. We would not, at a staff level, be able to approve that. That would have to come to the Board of County Commissioners for approval if they wanted to continue the same terms on
Doesn't
sale.
that sort of defeat our purpose of wanting to
Oh, they'd still,
recirculate the money and?
absolutely, but if we're continuing the affordability, that's
I mean,
the
that,
first
you know,
purpose.
when Mr. Weir was talking to us and explaining, you know, a lot of the projects, especially if they're market rate projects, they get turned, and then, the money comes back in and can be recycled and reused for the next project and so on. So, and understanding this is slightly different. It's not a market rate project with affordable and workforce housing. All right, thanks. And then I just thought it was interesting that there's another 30 units that are not county assisted that are for 30% and below. There's 8 of them that are 30% and below, and then there's another 22 that are 50% and below that are in this project as well, that are receiving other assistance.
And that's a carryover from before, to be honest with you. If you guys want us to restrict all 149, we don't have an issue with that. I think that's a little bit of a carryover, because originally those were the affordable units and we had applied under the workforce umbrella, but I have no problem proffering all 149 units to the county on that, so.
Okay.
Correct. They were encumbered by the sale money anyway, so they were already restricted.
So-
Just weren't part
Understood,
of
but
our
I think
workforce.
it's, when we look at the total, we're looking at the total project to know that there are other units that are
Yeah.
being restricted from another mechanism at another level as well. All right, thank you.
Ms. Baker?
Just wanted to clarify that point. If he's offering up that delta, I would say we include it in our overall agreement that we bring back to the board, and that way all 149 are then restricted.
I don't think timing of the deal is going to be important. We could just proffer that, and we will amend the term sheet right there, and we'll sign. I have no issues, no quorums about that. It could be a fully restricted project.
Thank you very much.
Thank you. Quick question. You're obviously had to do a pro forma to do this, and you came up with the rents. However, you came up with the maximum rents. Yeah. In your pro forma, was it based on your maximum rents or an average?
Well, it's all an average, but that's the maximum on the maximum gross rent on the chart for those units, those 110 units.
And if the market won't bear that, you're going to have to charge less.
Yes.
Okay, thank you. Commissioner Baxter and then Commissioner Powell. Vice Mayor, sorry.
Commissioner Powell go first.
Thank you. Thank you, Vice Mayor, and thank you, Mayor. The bedrooms, 610 square feet for 1 bedroom, 915 square feet for 2 bedrooms. And there's no 3 bedrooms, correct?
Correct.
Are those the average sizes of bedrooms that are currently being constructed?
Yeah, that's the average. It's not exact everyone like that, because we have different floor plans. So yes, great question.
Thank you. All right. And then the only other concern I have is, I know we need a number of units, and I know that rental units is important. But I will preface this by saying this, and we've had a number of people who come to us saying that we need more rental units, and they're fighting for rental units. My challenge is being from Riviera Beach, from the time that I was born, the fabric of the community has changed tremendously. And although we do need rental units, I would also like to see a push for more units that people can purchase. The cornerstone of wealth building in a community is homeownership. And people continue to be priced out of what we call paradise because they cannot afford to live, in many instances, where they were born or raised. I know a number of people who grew up with me who have gone to college and come back home, or who didn't go to college, who have moved out of the state because they cannot afford to live in Palm Beach County. So while there is this trend that we do need affordable units, and I know a lot of people may want to see a lot more of this, my challenge is us finding ways to come up with units that are affordable for people to purchase, whether it be units with accessory dwelling units or whether it be townhomes. There's the challenge where we looked earlier were people who work for the school district or work for Palm Beach County to not be able to afford to live in places where many of them have grown up. So that's a major challenge. So I do get the point that, you know, we may need more units, but I am of the nature that I would like to see some units, some effort put into units that will allow the people who I grew up with to be able to continue to live in Palm Beach County. And that's a challenge. So I support this based on some of the language that's been put in as safeguards, but I also wanted to make sure that it's on the record that we need to work extremely hard to be able to put in place units that people who are from here, who grew up here, who work here, to be able to stay here and live here. So with that, I'll close on my comments, Madam Mayor.
Thank you. Vice Mayor Baxter.
Thank you, Mayor. I'm going to build upon what Commissioner Powell had covered. Basically, and I appreciate your comments because I've always said I'd like to see more units that were for purchase. I mean, we have a lot coming on that are rentals, and I feel we have a severe lack of purchasable units for residents all across the county. And if we're putting dollars out there, and to Commissioner Weiss's point, when we sell or they sell, it can always, the funds come back to us and can be reused. And so I think as much as everyone knows how much I love workshops, I will say that I think it might be appropriate to maybe invite the Economic Council and Jack back to our commission chambers at some point and cover how the program specifically for purchase works and see if there are some tweaks that our newer commissioners would like to potentially cover in that program, because I know I've had issues and I would like to see how they feel about it in making it more friendly for purchasing units to come online, because I personally feel our current program does not make it very friendly to build units that can be for purchase. So if at some point, on to his point, and then we can all weigh in on where we feel that would be appreciated. I'm not going to put a timeline on this because we have a lot of information coming back, but let's just say, let's not wait 6 months. Okay, let's bring it back at some point a lot sooner so we can really dig into this, especially before. And do we know, Administrator Baker, how much of the $200 million bond is left for use?
I think we currently have about almost 81. So we got at least 100 million left to issue.
And of that first 100 million, how many are for purchase units?
Very limited.
Just one project, CLT.
8 units.
So it sounds like a perfect time to maybe cover that. If 8 units is all we have out of $100 million, that's a problem. So either way, if we could bring that back, sometime before the summer, it would be greatly appreciated.
Vice Mayor, we were looking at doing housing bond, another offering maybe April or May.
That would be
Would you like us
perfect.
to come back before we issue that RFP?
Yep,
Yes,
please. Yes. I appreciate it. And that's all I kind of wanted to add to this, and it's just information. I don't know if this is the new board direction thing, but it's asking for information to come back. Do you need a directive during Commissioner?
I don't see any objections, so we'll schedule that.
All right, thank you.
Thank you. Commissioner Sacks. And then let's wrap this up, because really we just have a couple motions, and let's keep our conversation to what our motions are. Thank you. Commissioner Sacks.
Thank you so much. Quickly, I want to concur with the Vice Mayor said, and if we could get this information to all of us individually before the workshop, it certainly helps us. We really need to know what we can do to solve this housing crisis. And just, talking to my colleagues, there are cities here that really need housing, affordable housing. And I'd like to see the spreadsheet of where we're going to work on our various municipalities and county. And I'd like to get an impact study from this, maybe not a study, but certainly discussion from our municipalities as how they're working with us. And this can be included in the Vice Mayor's workshop, how they're working with the county and getting more affordable housing. Thank you. And that's it.
Thank you. I believe we have one card.
We do, Albert Milo.
Want to do it again?
We're good. All right.
I'd like to make the motion to approve.
Okay, do I have a second? Second. I have a motion from Commissioner Flores, a second from Commissioner Weiss.
Don't we need to deny the housing bond
Three more
first?
minutes?
I do not.
Okay,
No,
okay, no, what we
motions.
have, actually, I'm going to ask the attorney, we have 4 motions. Do we need to take them separately? No. We have a motion to deny, approve, authorize, and approve a budget transfer. So what would you like us to do?
You can go, we approve, you probably do need to do them separately since they're kind of
Okay.
all over the place.
So the first motion will be to deny the housing bond loan program funding.
Second.
First from Commissioner Flores, a second from Commissioner Weiss. All in favor? Aye.
Aye.
All opposed? See that motion carries 7-0. The next motion will be to approve the Housing Initiatives Program.
Madam Mayor, quick question while you're in the middle of that. The caveat that Commissioner Wise recommended with all 140,
That would be in the term sheet, not part of this, but would be in the term sheet.
so we're approving with that added, with instructions to staff to make sure that's in the term sheet, correct?
Correct.
Thank you.
Yes.
Thank you.
We have to make them, we have to approve it.
Okay, so we're back to 3B, approving the housing initiative. Did I get a first and a second? I did. All in favor? Aye. No, we didn't get a first and a second. Commissioner Flores, Commissioner Weiss. Thank you. All in favor, say aye. Aye. Opposed? Motion carries 7-0. The third motion is to authorize the county administrator or designee to execute the loan agreement. That would include the term sheet.
And the 149, all project units, county assisted units, yes.
Thank you. I have a first from Commissioner Powell, second from Commissioner Flores. All in favor? All opposed? See, the motion carries 7-0. The fourth motion, 3D, is to approve a budget transfer of $4.719882 million. I have a first from Commissioner Flores, a second from Commissioner Weiss. I feel like an auctioneer. All in favor? Aye. All opposed? See that motion carries 7-0.
Thank you very much.
Mayor, could I?
Thank you.
Thank you.
Mayor, could I make a motion that we take the
COPCN?
COPCN and move it before the last add-on that, for board direction? To reorder, so that we would do our board direction discussion after COPCN? Okay.
Okay. So we have a motion to reorder and open the public hearing now. Correct? Am I doing this right? Okay.
Yeah, that's what I'm saying.
We have a
Should we go to
motion
them
from
first?
Commissioner Woodward, the Vice Mayor was the second. All in favor? All opposed? See that motion carries. So we are now going to reopen the public hearing. And we are now going to hear
4B1.
item 4B.
4B1.
4B1. Do we need to do proof of publication, or did we do that when we opened the meeting beforehand? Okay, that's what I thought. All right, this is gonna be a long one. Buckle up.
Doesn't have to be.
Buttercup.
Buckle up, Buttercup.
Not if you don't want it to.
Okay, who's going first?
I'll start. Oh. Good afternoon. Can you hear me? All right. For the record, Stephanie Shanahaw, Director of Public Safety. To my right, Todd Von Laren, Assistant County Administrator. Mary Blakeney, Director of Emergency Management. And Chief Ippolito, Deputy Chief for Palm Beach Gardens Fire Rescue, and also Chair of the Emergency Medical Services Advisory Council. To my left is Sharon Burrows. She is our Senior County Attorney. Richard Ellis, who is the Deputy Director for Emergency Management. And then behind us is Lee Moultrie. He's our Emergency Medical Service Program Coordinator. So the item before you today is to talk about the secondary COPCN applications. So today's agenda, we're going to be going over the application process. We're going to talk about who applied. We're going to provide a summary report on all the applications and then the administrator's recommendations. So just for some background, as I know we have two new commissioners on the dais. So pursuant to Florida Statute Chapter 401, in order for the state to license an applicant to provide emergency medical services, an applicant must obtain a certificate of public convenience and necessity from the county in which the applicant will operate. A certificate of public convenience and necessity is a certificate deeming it to be public convenience and necessity for an EMS provider to operate within the confines of the county as authorized in Florida Statute Chapter 401.25. Palm Beach County Emergency Medical Services Ordinance provides standards for issuing COPCNs in accordance with state guidelines. Secondary service COPCN holders provide secondary advanced life support transport services and advanced life support and basic life support interfacility transport services. Advanced life support transport services require a higher level of medical monitoring and include IV drips, chronic ventilator or cardiac monitoring. And BLS transport services require a lesser level of medical monitoring and include transports of medical and surgical patients not requiring cardiac monitoring or discharges to home or other facilities such as your nursing home, rehabs, and assisted living facilities. The application period for the secondary service provider COPCNs are issued every 6 years. The current COPCN service providers are with medical AMR, Medics, and HCD, which will expire June 30th of 2027. In the month of October of 2024, the Board of County Commissioners had a first reading of the ordinance revision to the Palm Beach County Code, Section 13-22 of the Emergency Medical Services Ordinance. Staff recommended to approve on preliminary reading and requested permission to advertise for a public hearing on October 22nd, which was adopted by this board. At the ordinance revision public hearing on October 22nd, 2024, staff recommended a motion to adopt the amendment to the Palm Beach County Emergency Medical Services Ordinance, to accept secondary provider applications, and to receive and file the administrator's report, approve and determine there was an EMS public safety need for additional secondary providers, and direct the county administrator or designee to open up an additional application period to accept new applications for additional secondary providers, which was also approved by the BCC, which is why we are here today. On October 22nd of 2024, the BCC voted to open up that application process, and the timeline is as follows. On October 25th, we opened up the application period to accept additional secondary providers. On November 15th, we closed the application period at 5 p.m. On December 20th, the COPCN application review process was complete by staff. On January 16th, we submitted our recommendations to the EMS Council, and the EMS Council also provided their recommendations. And on January 22nd, we presented this information to the League of Cities, and then we are here today at this public hearing recommending to the Board of County Commissioners. So pursuant to the EMS ordinance, my responsibilities as the administrator include the following: to review the applications and obtain verification that the applicant meets requirements of all federal, state, and local laws. I am to confirm there are no outstanding complaints against any of the applicants. I'm to consider the need for the proposed service. I'm to prepare and present a report with recommendations to the EMS Council for review. I'm to request the EMS Council's recommendation on the applications to be provided to the Board of County Commissioners, and then I'm to schedule the public hearing, which is what we're doing today. Pursuant to the EMS ordinance, the EMS Council's responsibilities are the following: to review the administrator's report on all the applications. Each applicant may provide a 10-minute presentation at the EMS Council, which they did. The council members can ask questions after each applicant report is presented, and then a motion is to be made by each council member and seconded by another to recommend to the BCC to approve or deny each applicant, and that was outlined in your agenda item today. The Emergency Medical Services Advisory Council was created back in 1973 by the Board of County Commissioner and provides recommendations for improving emergency medical services here in Palm Beach County. The council consists of 20 members, which includes the Fire Chiefs Association, the Emergency Room Nurses Forum, the private ambulance provider, the Palm Beach County Health District, Trauma District, the Palm Beach County Emergency Medical Services Providers, EMS, or the Economic Council of Palm Beach County, emergency room physician, EMS educator, a consumer by each of the Board of County Commissioners districts, Palm Beach County Emergency Medical Directors Association, the union, Palm Beach County Fire Union, and 3 hospital CEOs. As part of the EMS ordinance, the administrator will provide a report, which is what I'm doing today, with a recommendation to the BCC, and it will also include the recommendation of the EMS Council and any relevant documentation. All applicants are encouraged to attend the BCC public hearing, and each person will be allowed a 3 minutes to speak if a public comment card is timely completed, and the BCC will approve or deny each of the applications at today's scheduled public hearing. So now moving on to the application summary report. We received a total of 6 companies that applied for a secondary COPCN. 1, MCT Express, doing business as All County Ambulance. 2, eCare Ambulance. 3, Positive Mobility, doing business as Elite Medical Response. 4, HCA Florida's Palms West. 5, National Health Transport. And 6, Rapid Response Medical Transportation. It should be noted that the current COPCN holders, AMR, Medics, and the Healthcare District did not have to apply during this process. They will have to reapply at the end of their period, which is June 30th of 2027. So now I'm going to go into the application criteria and EMS ordinance requirements. These next 2 slides outline the application criteria and EMS ordinance requirements. Each numbered rows corresponds with the number of documents that we requested in the secondary provider COPCN application, which was 24 pieces of information. The blue rows with bold font represent the application requirements pursuant to the EMS ordinance, while the white rows were supplemental information that we requested to help determine levels of qualification. As part of the EMS ordinance rewrite, we will be including this information as part of the application requirements, but we did not deny anyone that did not meet the white rows. So all applicants provided a statement of need. All County Ambulance discussed the growth of Palm Beach County and the need for adaptation of pre-hospital healthcare services and described how they have the capacity to meet those needs. eCare Ambulance met with local healthcare facilities to ascertain what their needs were regarding EMS. They sent out numerous surveys to collect this information and found that there was a significant need for interfacility transfers involving ALS and BLS services because of the extended wait times and lack of availability. Elite Medical Response has been following the conversations and meetings between Palm Beach County Administration and the Board of County Commissioners, along with observation of the EMS landscape within the division or within the region. They feel that there is a significant need for additional secondary providers. HCA Florida's Palms West feels the secondary interfacility transport services within Palm Beach County are critically underperforming, and they would like to fill this gap by bringing their EMS operations into Palm Beach County. National Health Transport has been repeatedly asked by their partners to bring their services into Palm Beach County, and Rapid Medical Response currently transports their patients into the county to higher acuity hospitals. They see a growing demand for more EMS and would like to contribute their services to residents and facilities within Palm Beach County. This was just a recap of what they provided, but there was additional information in their application. We just summarized it. For the service areas to be covered, all applicants will provide countywide services with the exception of HCA Palms West, which would be limited to the HCA Florida Palms West patients needing transports between HCA Florida Palms West and other medical facilities. This chart provides an overview of each of the company's start dates, the staff equipment that they're going to dedicate to Palm Beach County, and their rate structure. The column on the left lists the 6 applicants, and as you move from left to right, you will find each of the providers' proposed start dates, the total number of staff listed on their state profile sheet, and total staff being dedicated to Palm Beach County, the total vehicles listed on their state profile sheet, and the total vehicles dedicated to Palm Beach County, and their proposed rate structure breakdowns. All companies are proposing quick start dates if awarded a COPCN, with the exception of HCA Palms West, expected to be ready to start operations July 1st of 2025. All companies are dedicating between 40 and 50 plus personnel to Palm Beach County, with the exception of HCA stating that they plan to hire staff if awarded a COPCN. And All County Ambulance holds the biggest state roster at 353 employees, followed by National Health Transport with 143 employees. All companies are dedicating varying amounts of vehicles to Palm Beach County, with the exception of HCA stating that they are ready to purchase 3 vehicles and 1 backup if awarded a COPCN. Elite is offering the most vehicles to Palm Beach County at a total of 30, with 14 additional units on back order. eCare comes in next, dedicating 25 vehicles, also willing to purchase more if needed. 8 All County Ambulance and National Health Transport hold the biggest state footprint, with All County Ambulance offering 15 vehicles to Palm Beach County and National Health Transport offering 10 vehicles to Palm Beach County, both willing to also purchase more if needed. All applicants propose rate structure with varying services description and costs. The applicants all gave different rate structures based on different variables such as population, staffing, number of vehicles, patients being served, etc. This slide represents 3 categories of response time requirements that secondary COPCN holders must adhere to each month pursuant to our EMS ordinance. As part of the regulatory process for emergency medical services, all COPCN holders must submit EMS run data to our office on a monthly basis and adhere to the following response time requirements. 6.1 is all priority 1 interfacility transports to a higher level of care requires the COPCN holder to respond within 10 minutes on average each month. 6.2, for urgent transports that are not pre-scheduled, the COPCN holder must respond within 30 minutes of the agreed upon time, 90% of the month. For 6.3, those are pre-scheduled transports, the COPCN holder must respond within 15 minutes of the agreed upon time, 90% of the time each month. This chart compares each applicant's operational activity over the past 6 months. As in the previous slides, the applicants are listed on the left, and as you move from left to right, you will see along the top of those response time requirements I just mentioned, 6.1, 6.2, and 6.3, which sum the total of runs over 6 months for each applicant. The second to last column sums up all runs for each of the applicant over 6-month period. Excuse me. There were multiple reasons for requesting this data in the secondary provider application. Number 1, it's required by the EMS ordinance if you are a COPCN holder. This information helps us see what level of operation the applicant is currently providing. This in turn helps us determine how, if the applicant can contribute to the identified needs within Palm Beach County. The last column identifies what counties this data was reported from. So for MCT Express, All County Ambulance at the top, that data was reported for Miami-Dade County. For eCare, that was Monroe County. For Positive Mobility doing business as Elite, they stated that they're currently serving 10 Florida counties spread across a variety of rural, suburban, and urban areas, and they completed this information using combined data from operations across the state. HCA Palms West indicated that they operate 9 different operations within the state of Florida, and this data is a sample of those operations that resemble the operations most closely matching the Palm Beach County market. National Health Transport data was from Broward County, and Rapid Response Medical was from Hendry and Highlands County. So this slide is a comparison chart showing the compliance of each applicant with the EMS ordinance application requirements. If you recall on the slide of the blue and white rows, those were ordinance requirements. So we looked at what was just required in the ordinance, as we can't deny an applicant if they didn't meet one of the white rows. So vertically along the left of the chart, there's the 6 applicants listed as we did on the previous slide. And as you move along from the left to the right, you will find the required application elements in numerical order. The check marks indicate compliance, with the highlighted yellow box indicating non-compliance. If the applicant was not able to produce any of these elements by the determined deadline, they were considered disqualified. So for rapid response medical transportation, they did not submit audited financial statements for the past 3 years, and audited financial statements are a significant element requirement for the EMS ordinance. You will notice the asterisk marks indicated on HCA Palms West line. HCA indicated they will proceed with meeting the application requirements if awarded a COPCN today. Similar to the previous charts provided, we wanted to provide a recap of the information we just presented and what led us to the 2 providers that we are recommending by staff for approval as outlined in today's agenda item. Our administrative team thoroughly reviewed each candidate's application. We carefully inspected each of the 6 applications submitted, accounted for all the required elements as outlined in the EMS ordinance, and considered the need for the proposed services and also the direction that was discussed during the BCC workshop back in August of 2024 and the October meetings. This additional application process was initiated to address an urgent need, which was to add additional secondary service providers as quickly as possible. Therefore, our primary focus was identifying who could quickly begin operations and meet the county's EMS transport needs. Other key factors in our evaluation included Palm Beach County's size, with over 1.5 million residents, and the need for experience in high-volume EMS operations. We prioritize candidates with a proven track record of providing EMS transports in large populated areas of over 1 million people and has existing EMS operations in nearby counties who can start immediately. With these factors taken into consideration, All County Ambulance and National Health Transport stood out. All County Ambulance has 23 years of experience handling over 100 EMS runs daily and services 2 other counties with populations exceeding over 1 million. While National Health Transport had 14 years of experience also handling over 100 EMS runs daily and services 3 other counties with populations of over 1 million. Additionally, we believe that both All County Ambulance and National Health Transport have the necessary infrastructure and proximity to Palm Beach County to support our EMS call volume, currently with the current provider averages 100 runs per day. We also evaluated their ability to scale operations quickly if needed. We already know that the current provider has challenges with staffing their vehicles. Given the size of All County Ambulance and National Health Transport's existing operations, we feel that both of these companies understand the challenges of upstaffing and adding resources as demand increases, and would be able to do so if needed, given their close proximity in other counties like Broward and Miami-Dade. None of the other applicants, eCare, Elite, HCA Palms West, and Rapid Response Medical, met these key factors that we took into consideration. The ordinance also requires applicants to specify a start date. All applicants indicated readiness to begin immediately today or by March 1st, except for Palms West, which projected a start date of July 1st. This process of adding additional providers presents a valuable opportunity to gather data and assess the optimal number of secondary providers needed when the full application process will reopen in approximately 18 months. Given this, we carefully considered the impact of our selections and determined that recommending 2 providers at this time would best support the immediate need in here in Palm Beach County, while allowing us to evaluate the system capacity, provider performance, and overall service demand. This approach ensures that future decisions are informed by real operational insights, positioning us to be more effective in our long-term strategy. So as required by the EMS ordinance, I am to present to you my recommendations, which are the following. Denial of secondary COPCNs to the following applicants based on staff's review did not meet the need for the proposed service. Positive Mobility, doing business as Elite Medical Response, HCA Florida Palms West, eCare Ambulance, and Rapid Response Medical Transportation. As a reminder, Rapid Response Medical Transportation failed to meet the application requirements outlined in the ordinance, which also supports denial of their applications. And I am recommending approval of secondary COPCNs to the following applicants: MCT Express doing business as All County Ambulance and National Health Transport, based on the staff's review that they met the need for the proposed service. Also, pursuant to the EMS ordinance, the EMS Council is also required to make a recommendation to this board on each applicant. As a result, the EMS Council recommended the following: denial of secondary COPCNs to the following applicants: eCare Ambulance and Rapid Response Medical Transportation. And they recommended approval of secondary COPCNs to the following applicants: MCT Express doing business as All County Ambulance, National Health Transport, Positive Mobility doing business as Elite Medical Response, and HCA Florida Palms West. That concludes my presentation.
Thank you. How many cards do we have? We have 20 cards, 20 speaking cards. And I'm sure of those 20 speaking cards, we have several of the providers. Okay. What I would like to do, if it would be okay with the board, is I would like to give the providers 3 minutes each, and then everyone else gets 2, if that would be all right with the board.
Will Commissioner Woodward tell us which ones are provider cards? I can read this first. Sure.
And I now have two lights on for questions. We didn't have lights on yet, so okay. Commissioner Weiss.
Thank you, Mayor. I have 2 questions for staff. I was sort of, I was surprised to see that we didn't require a certificate of insurance in the ordinance. And so I'd like to recommend that we look in the future to add that in. And then my other question, you talked about...
That's a requirement, it is.
Oh.
If you go to number 7 on slide 15, I'm sorry, it is not a requirement, but that will be added, yes. I'm sorry, I apologize. Yes.
I thought I could tell my colors apart.
Yeah, I'm sorry, I thought you were meaning it wasn't a part of the application, yeah, so.
Okay, thank you. And then secondly, when you're talking about the size of our population changes quite a bit during season. We have a lot of additional. Do we have any sense of how big our population is? Because when I talk to the hospitals, one of the challenges they said they face is during season, the need for hospitalization goes up significantly here, and that the importance of being able to move somebody out of the hospital who's ready to be transported to free up a bed is really important. So do we know how big that is?
So right now, the data that we collect from the providers, as far as the number of runs that they do, is not per hospital. That's something that we could look into moving forward, because right now it's just the total number of runs that they perform. We have been given some heat maps, but it's proprietary information and it's not a requirement of the ordinance, but we will be coming back to this board hopefully sometime soon to discuss EMS ordinance revisions, and that's something that we can add in additional information that we collect from the current providers.
Okay, because I think we say we're 1.5 million people, but during season we're a lot more than 1.5 million people, and we need to be able to respond differently to that increased population and the needs that they bring to our community.
Yeah, thank you for that point. And as you know, sometimes getting that information, I know HCA has been very supportive on giving us data, but that's not, countywide that we're getting that information. And I know that it's not a requirement of the ordinance, so we take what we can get. But that is something that we can definitely potentially require for future ordinance revisions.
And I said I had 2 questions, and then I have one comment, which is, and I mentioned this to you when we met in person, which is I think we need to have another category of providers, such as what's being requested by HCA and what Healthcare District does, where they're taking care of interfacility transfers for their own needs. And because to compare them to a regular transport, it's not really, doesn't seem... it's not accurate. I mean, they're not serving sort of the greater public, or the medical public, I guess is.
Thank you. Commissioner Sachs.
Thank you, Madam Mayor. And the question is really for your order. When the applicants speak, the providers. Will we be able to ask questions at that time to them?
You know how I feel about that. Yes, I think it would be apropos. I mean, however, they did have 10 minutes to present, and so the results of what we have today are from their 10-minute presentations to the EMS Council. So I would like to keep our questions to a minimum, but obviously you are going to have questions.
And one other question I have, which was brought up by Commissioner Weiss, and this is to Stephanie, is it possible to have, and it may be that ship is already gone, but with regard to the providers that go between intra-district or between hospitals, is it possible to have 2 tiers, maybe not now, but in a couple of years, to look at those like the healthcare district and HCA, to have 2 tiers of providers? And I know the attorney's looking over here. Is that possible, not for now, but in 2 years to look at it that way, so that one tier is for the public and the other tier is for those between HCA, hospitals and the healthcare district?
Yes, so as part of our ordinance rewrite, we will definitely
Review
add that information. And of course, the ordinance revisions would have to be approved by, a vote of this board. But that is something that we can add in. And at the workshop, this board will have an opportunity to provide feedback to us and direct us to add anything that they want included in the ordinance.
And that would also include any hospitals that would have their own, maybe I know some of them spoke to me about in the future they may have their own transportation system right there. So we could review that for the 2027 date, huh?
Yeah.
Okay, very good. Thank you, Commissioner, for bringing that up. Thanks, Madam Mayor.
Commissioner Powell?
Thank you, Madam Mayor. Considering the short time frame that we're looking at in terms of this test period for adding new providers to the COPCN, I think it's important that we do really consider how do we account for an HCA on the scale of evaluation. And maybe you can tell me that, Stephanie, in terms of the short time period that we're looking at, if HCA were to be included, how do we evaluate HCA service against those of the other providers that are part of this?
So as a secondary COPCN holder, they would be required to submit the same information as another private provider. So just because they're a hospital doesn't make them any different. So the number of EMS runs that they're responding to on a monthly basis, they would have to submit to us, the same as healthcare district does as well. We monitor that data the same as we would any other provider.
Thank you.
And we would also inspect their vehicles as well as their staff.
Thank you.
Actually, I do have a question. Average response times. So you have priority, urgent, and pre-scheduled. And so if someone pre-schedules, but they say they can't be there for 3 hours, and they're there 3 hours later, they're technically on time.
Correct. It's an agreed upon time, which is the way the ordinance is currently written.
Which is another reason why we're trying to add providers, because while it may be scheduled for 3 hours, that is still not getting that person out of the hospital promptly and getting them to wherever they need to be.
Yes.
I just wanted to clarify that. So at this point, we're going to go ahead and we're going to take the applicants first. Do you know who those are?
I identified on the cards, I have 2 from eCare, 2 from All County, and 1 from Elite, but there are other cards that maybe they didn't say who they're with. So should I just start with who did
Yes,
identify
so
themselves?
Let's go
Okay.
ahead and actually, I'm going to go out of order. Did anyone from MCT put a card in?
I have 2 cards from, it's MCT All County. I have 2 cards from them, and if there's additional that didn't identify. I have Jeff Atwater and Charles Mayman.
Who would like to take their 3 minutes? And then the next gets 2. Or maybe you can all just get all our answers, our questions answered at one time.
Madam Mayor, thank you. Madam Vice Mayor, Commissioners, thank you. Jeff Atwater, representing MCT All County. But out of respect, yes, I was intending to turn that over. I just would like to say, as a resident, my gratitude to the expertise, really the care, the thoughtfulness, the thoroughness of your staff and Stephanie's team that so quickly dealt with all of this and carefully. Charlie Mayman, our Vice President.
Charlie.
Mayor, I'm going to pause. I can't hardly hear. I don't know if it's that microphone or where they're speaking.
Can you hear me okay now?
Yep.
Okay. Mayor, Commissioners, good afternoon. Charlie Mayman for MCT Express, doing business as All County Ambulance. We also want to thank staff for an excellent process that has brought us to this point today for your decision-making. MCT is unique in that we do have both the recommendation of staff and the EMS Council, and we're very grateful for that. MCT was founded in 2001 and now has 3 sister companies serving 27 Florida counties. And while we are a large organization possessing what would be, if we start in Palm Beach County, 290 ambulances statewide currently, we want to let you know that we're very committed to Palm Beach County, always focused on the local market. And the depth and experience within our organization speaks to itself. Our management team combined has over 200 years of private sector EMS experience. We've intentionally developed our management team, and our general manager, who will lead our Palm Beach County operation, Jenny Pettigrew, is in the audience today, has 43 years of private sector EMS experience and is a local Lake Worth resident, and has spent a lifetime involved, if you will, in Palm Beach County over the years. One of the questions that was raised at the EMS Council that we think is very important, we wanted to make sure that the Commission understands our organization is prepared to serve the entire county. And from the entire county, we're talking from Boca to Palm Beach Gardens North, and from the beach all the way to the Glades. And that was really one of the questions that arose. Are you prepared to serve the Glades? And the answer is yes, we will be present county-wide. We've designated capital for our Palm Beach County operation. We've acquired vehicles and the equipment to equip those vehicles, and they are ready to go. We have staff that's ready to go. We're beginning with 15 ambulances, and our hope is to grow that number of ambulances to as many as we possibly can support. So if it's 30, 40, 50, 60, whatever we can support in Palm Beach County, we're prepared to grow to. And we have the depth and the ability to do it quickly, immediately, as our business grows. We're going to be working with Palm Beach College and local training centers to gain further staff. And in short, Commissioners, we are ready to go. We're prepared starting as quickly as March 1 or earlier, so we just need to get the license back from the state of Florida that has the Palm Beach endorsement on it, and we can operate. Thank you for your time.
Thank you. Do I have any questions? Commissioner Flores.
I'm going to be asking the same questions out of all of them, but where are you guys headquartered?
So we have headquarters currently. We have 2 pieces of property. Thank you for, it's a great question, Commissioner. Thank you for it. We have 2 pieces of property that we're working on in Palm Beach County, and within the next 48 to 72 hours, we'll close on one of those pieces of property. One is in Boynton Beach, and one is in Military Trail in West Palm.
So you're moving your headquarters to Palm Beach County?
We are creating a headquarters in Palm Beach County. We have 4 companies, so our base of operations right now are in Miami, Fort Lauderdale. We have bases. We have a base in Fort Pierce. We have a base in Orlando, and we have a base in Jacksonville. We will be creating that same base of operations here in Palm Beach County, which will house our vehicles, our staff, and our dispatch center for Palm Beach County.
So you're adding 15 vehicles.
Yes, sir.
That's what you're proposing to Palm Beach County, and you need 2 locations for that?
No, sir. There'll be one in Palm Beach County.
Okay.
One in Palm Beach
Oh, you're
County.
looking at 2 different properties?
We're looking at 2 different properties right now. Yes, sir.
And how did you arrive at that 15?
It's a starting point, Commissioner. You know, we have the ability, by the way, Commissioner, tomorrow morning, if we started with 15 and I need 20, within a matter of a day or 2, I can have 20 here. If I need 25, I can do that. We're an organization that has a lot of depth and a lot of vehicles available in the state of Florida, so we have the ability to purchase, move, do whatever is necessary to support Palm Beach County.
And my last question is, where are these 15 vehicles right now?
They're sitting in our Miami headquarters.
Okay, so you're going to pull them out of Miami to service Palm Beach County?
No, they've been purchased and prepped. They're just sitting there waiting to bring into Palm Beach County. They're dedicated to Palm Beach. We're not pulling them from anywhere else. They're separately purchased for Palm Beach County. They're just sitting in our Miami office right now.
Thank you.
Commissioner Sacks.
And thank you, Mayor, for the opportunity. Sir, I have one question, too. What do you do for our community here in Palm Beach County? Do you do any community outreach, sir? And if so, what is that?
Do we currently do any, Commissioner? I'm sorry, is that your question? Yes, sir. We do not. We have supported Palm Beach County, of course, during COVID, just as many other services have in the state also. But we will become involved in Palm Beach County and support whatever programs are appropriate for us to support that we pick, choose, or that, you know, come our way, the opportunities that are there. We are very involved in, you know, locally in all of the counties that we serve. And some of it has to do with children, some of it has to do with seniors, different programs, but we are involved.
And one, if I could, Mayor, what sets your company apart from the others, sir?
So, Commissioner, you know, I spoke to the fact that the size, you know, the reason I mentioned that we're a large company that serves 227 Florida counties, and that we have currently 275 ambulances in service. Sometimes when you look at a company, to be big is to be bad. On the other hand, we also have the depth, okay, to serve Palm Beach County in the event of an emergency. We have tremendous depth with vehicles, staff, and knowledge. So if there was an event, God forbid, in Palm Beach County that required to move the cavalry, if you will, we have the availability to do that. So I feel that sets us apart. Thank you, ma'am.
Okay. Do we have a representative from National Health Transport who filled out a card?
I have Raul Rodriguez, or is there someone else? I think that's okay.
Hello, everyone. Raul Rodriguez, founder and CEO of National Health Transport.
Go right ahead.
Good morning, Madam Mayor. Good morning, Vice Mayor. And good morning, County Commission. As I said before, my name is Raul Rodriguez. I'm the founder and CEO of National Health Transport. All of you already know my story and why my team of over 500 employees are here committed to patient care in your community. We have over 110 vehicles statewide and 10 units already committed to your county. Oh, I finally got the thing to work. Good. Awesome. I just wanted to say thank you for this opportunity to expand the services that we are already doing in your county, helping the patients that need it. We support the recommendation of the Director of Public Safety and your staff. I'm humbly here before you to answer any questions you might have. Thank you.
Commissioner Flores?
Right within the minute, so I think we're good.
All right, the same question. So where are you guys currently headquartered?
So, sir, or Commissioner, we have our headquarters is in Miami-Dade County, but we have 5 offices throughout the state. Our goal is to open an office here in the Palm Beach area by Lake Worth. We have our Director of Operations, which is a Palm Beach resident, former fire chief, here to expand on the services, and we're currently looking at 2 other facilities as well.
So you got on your application, you're saying you're going to start with 10
Yes, sir.
Vehicles. How did you arrive at that number?
That's 10, typically in every metropolis over 1 million population. That's a ratio that we use, so we calculated 10. But again, as the previous provider mentioned, we have the opportunity to expand within 48 hours, an extra 5 or 6 units if need be, if that demand so rises. Remember, we are already doing transportations here in your county from one county to another since we surround your county. So a lot of the patients that need to come in or out of the county, we're already providing those services for. So it's a matter of just continuing the service that we're providing, but now it would be more within your county.
And the same question as the last applicant, where are those vehicles right now?
So we have 4 units in Miami-Dade County. Not that they're running Miami-Dade County, they're stationed in Miami County, ready to be shipped over here. And we have another 4 in Broward County and 2 in Martin County, just ready to get shipped. Already stacked and equipped.
Thank you.
Thank you. Commissioner Sacks?
Thank you, Madam Mayor. Again, what community services? And I know you've been based in Broward and Miami and Martin, but what community services are you
I
anticipating
would love
doing?
to answer that question, ma'am. So I started the foundation that I have is called Lou Abner Foundation 14 years ago. We have over 500 kids in the program, affluent kids that do not have the wherewithal to go to tutoring, SET prep, martial arts, etc. So we have over 400 kids in the program, and 3 of them have already gotten scholarships to go to universities, which otherwise would never have that opportunity. We also do an annual Thanksgiving Day Bash where we feed over 10,000 people on an annual basis. And the one event that is near and dear to my heart is Disney on Wheels, which actually happens at the end of this month, where we transport, this year we're going to transport 80 children who are terminally ill, quadriplegic to Disney World for the weekend. Besides that, in every county that we operate, we help other nonprofits and other organizations that need help with charity, with fundraising, to help them.
What sets you up? Sorry, what sets you apart from the other applicants, sir? Thank you, madam.
To answer that question, for the ones that don't know the answer, for me, it's what sets me aside, my father. I started the company for my dad to transport him. He was my first transport, and then 3 weeks later, he passes away. Here we are 14 years later, honoring his name. That's what sets me apart. No problem.
Thank you. Commissioner Powell.
Thank you, Madam Mayor. And I want to thank all the applicants for coming before us. 2 thoughts come to my mind. The number one is, as Commissioner Flores asked the question with regard to vehicles, and I've heard 2 entities indicate that you already have the vehicles here. As a matter of fact, they're already dedicated, they're ready to go. If you are not successful today in terms of being one of the applicants who's selected, number one, what are you doing with those vehicles? Are you just holding on to them? Are they just, if they're ready to go already, I just want to know, was that anticipatory movement? And then that's the first question. Then the second question is, in terms of diversity and upward mobility, I know we've asked the question with regard to the number of jobs and what the pay is. I want to know about the likelihood of diverse populations being able to get into the field and move up. And when I talk about diverse populations, I mean people who look like the community, the breakdown of the community, including the community that I live in. Those are the 2 things. Thank you.
Commissioner, to answer question number 1, if for whatever reason that does not happen, those 10 units will be put to use. Obviously, again, the size of our company, we're always purchasing more units, we're always putting units to work, so no unit that we have will not be used. Maybe not right off the bat, but eventually all the units will be used and actually help us with expansion, correct? That's number 1. Number 2, with our existing workforce here, once we get in, as I mentioned to you before, our directors of operation, which is here today, Mark Ellis, which was a former fire chief, his goal is to go to all the schools countywide to offer all the high schools who have EMS programs the opportunity for those kids who graduate, already have a job, and have the skill set to be able to become an EMT, a paramedic. So not only will they have a job, they'll have a paid education to grow with the company and then eventually move on to whatever they so choose to do so.
Thank you. Commissioner Woodward.
Thank you. This question is actually for staff. When we did our needs assessment for this, I don't know if it was a needs assessment, but the study that we did we determine how many trucks would be ideal for our county?
Yeah, so we looked into the data that we currently get from our current provider. And right now they're running around 25, 30 trucks a day, or that's what their data shows them that they should run. And there's no national average, but we know that there obviously is a need for more trucks on the road. The problem is the staffing. So right now, based on what they're providing us, is about the 25, 30 trucks. And I did some sort of analysis. I've kind of a data nerd, if you will, where, based on our population, 1.5 million, if you have, so many trucks per 50,000 people, it'll give you around 30 trucks or so. So we're all within the same ballpark, but there's no national average that I could find, but just based on my own, review of what we're receiving from our current provider, as well as our population and the service levels that we need to provide here in Palm Beach County, I would say, 30 to 35 trucks a day is ideal. The issue is the staffing.
Okay, thank
And
you.
it could go up to, I'm sorry, I wanted to add just peak periods, as Commissioner Weiss alluded to earlier, that, maybe during, holiday times where, our population is higher, hospitals are seeing more, patients arrive. That could also be a peak period and even more trucks are needed. So maybe up to 40 to 45 trucks.
Up to 40 to 45 during peak?
Yeah.
And then 30 to 35?
I would say, yeah.
Okay, thank you.
Thank you.
Thank you, Mayor.
Okay. Who do we have here from Elite Medical that would like to go under the firing squad?
I have a card from Bill Hall. Is that, or is there more? Just please identify yourself so I can find your card, please.
Esteemed members of the commission, and thank you for the opportunity to speak today. My name is Bill Hall, and I'm proudly here representing Elite Medical Response, a company that was built with a specific intent for Palm Beach County. I'd like to say more, my cliche is we have a Palm Beach purpose. At the heart of our mission is our management team, a team composed of ambulance professionals, hospital and hospice experts, as well as a retired Palm Beach County firefighter. A team with extensive tenure in the industry with over 200 years specific to Palm Beach County EMS. 200 years specific in Palm Beach County. Our team members, with the exception of one, have lived in Palm Beach County for 25 years or more. Together, we bring a wealth of knowledge and a deep understanding of the unique needs that surrounds the healthcare partners and your constituents. As we seek to become an ambulance provider in the county, we're 100% committed to delivering an elevated level of care, and we are focused on three key pillars to help us do so: enhanced patient care, faster response times, and a strong community involvement. All of those matters were discussed through meetings with you all and during our presentation with the EMS Council. We're a leadership team who understands the county's EMS landscape. Some of us even helped design some of that and work through that process throughout the years. Again, we're committed to strategies that will reduce response times, enhance community relations, and provide comprehensive solutions. Our goal is not to only meet, but to exceed expectations and provide a service that everyone can rely on. We also look to continue to be active participants and not just around the COPCN bid, throughout the whole entire cycle. I think we've demonstrated that over the years throughout my tenure in Palm Beach County, throughout Fred's tenure in Palm Beach County. In closing, we're excited for this opportunity. Our commitment to excellence, community engagement, and patient care is the foundation of our operations. Together, we look forward to making a positive impact and serving the community. Thank you very much for your patience. I know this has been pretty taxing on all of you and your cooperation in the matter. I think I have 18 seconds left, and I'll take any questions that you may have.
Commissioner Flores.
All right, same questions. Where are you guys currently headquartered? Sebring, Florida. Sebring. And you put in the application, where are you? Oh, right here. You're adding 30 vehicles to Palm Beach County? That's correct. And those vehicles are currently where?
They're located in our Sebring operations, but we plan to move our headquarters to Palm Beach County.
Okay, and are you pulling services from them to provide to us, or?
No, these are 30 vehicles. 19 were purchased. We just received 4 more, so we're at 23 right now, and we have 7 more on back order that will be delivered by April 30th. And letter was with our application.
Okay, thank you so much.
Actually, Commissioner Powell, your light was on before Commissioner Sachs. He got in there before you.
Commissioner Sachs.
Okay, Commissioner Sachs. Commissioner Powell is...
You're too kind. Thank you.
She's watching you.
I just want to echo the previous question that I asked to the previous speaker. Those two items are important. So if you could explain both the upward mobility and the place where, if you are not selected, where those trucks are going to be, if they're already in Sebring and they're going to stay in Sebring, or what's the case.
Sure. Thank you. First thing is by moving our headquarters here to Palm Beach County, where we all live and have grown up here, we've estimated that we're going to have about $152 million impact. Even currently, right now, while we're headquartered in Sebring, all of our uniforms are purchased here from a Palm Beach County vendor. Our trucks are wrapped at Coffs right there on North Lake Boulevard, a Palm Beach County vendor. Our medical supplies are bought from Palm Beach County vendors. We're doing our business here in Palm Beach County, and that's what we plan on doing. We're going to revert back to what we did while we were running another ambulance company, which was we're going to work with our career source folks to bring this pipeline out of the schools and move these people through and earn while they learn. So they'll have a full-time job, pay benefits. We are probably the highest paid in the state for EMTs, paramedics, and nurses. We're the only group that's running nurses on the trucks. And then for our management team, those people inside also have an opportunity to move up as we grow into operations managers. They start off as supervisors on the truck, into our billing, our dispatch, which we do all emergency medical dispatchers. We're accredited facility nationally, so every person there is already trained. They can move over to fire rescue or the sheriff's office and run through that data card base. So we're training people on a high level, and all of our paramedics are trained for the critical care, which normally it's about 10% of the staff. So we're given that extra training already, and we carry a critical care nurse on the most acute calls.
Thank you. Last question.
Go right ahead.
You indicate that you all will be able to do an Uber-like service or be closer to the individuals who are needing service. I see of your calls, looks like 80% of them have been the pre-scheduled transports, then a little higher, 17% almost, and this is the 357 have been urgent transport, not pre-scheduled, within 30 minutes. How does that work exactly? And I know, considering that a bulk of what you do right now, according to the EMS operational activity over 6 months, looks like it is pre-scheduled transports within 15 minutes of the agreed upon time that's pre-scheduled. How do you make that shift to prioritize both the higher level of care for the priority 1 transport and then the urgent transport? And then even if you could explain to me the Uber type service technology that you all were talking about.
Sure. Since we submitted those numbers, our numbers have tripled, more so on the high acuity. And what we do is once we go into an area that we're familiar with, we use our technology, TraumaSoft, we use heat map services, and we start to position around our partners in strategic locations to make certain that we have rapid response times, and we hit our internal goals as well as the goals set by the counties. One of the things that we did in our previous history when I worked here in Palm Beach County is we strategically put stations around the entire county. You had 9 stations, and the data was gathered. We looked at zip code reports, and we put stations in those areas to make certain that we could pounce on those calls and make certain we were within time for high acuity calls, scheduled calls, all the calls.
But specific now, through the technology of dispatch, people will be able to text in a call. We have video, so if they say they have a obese, a very heavy patient, we could literally hook up with a link, video into the hospital to see the size of the patient, so we know that we're sending the proper unit into there. Even when our paramedic or our nurses are driving down the road, they can link back in with a regular medical doctor if there's a problem. And some of these transports are 3 hours. Like you could be leaving here and going to Shands Hospital or down to Broward to Cleveland Clinic Broward for a heart transplant, that type of stuff.
Thank you.
Mm-hmm.
And one of the things I wanted to go back to Commissioner Flores, if I could, about the 30 units. In my prior tenure, when I ran the county here,
we used to put up 65 trucks Monday through Thursday and 80 on Fridays to service this county. I don't know where those numbers came from, 25 or 30, but I know our county has grown since then. There's more population, there's more transports. So I'm a little confused with that, because the 65 to 80 allowed us to stay compliant, make certain that we were on time, and strategize around the system status. So I just wanted to bring, that's where we got the number 30 at. I looked at what you were currently getting or being provided, and we came in with the delta.
And let me just, as a reminder to everyone, this is not that the current providers we have in place are going away. These are adding additional providers. So all of the trucks that are in place right now, whether they're on time or not, they are still in place. We're not replacing them. Everything is up for grabs in 2027, but right now what we're doing here is just adding, whether it's 1, 2, 3, 4, 5, 6 providers. That's what we're just. These are going to be additional trucks that'll be on the road.
Yes.
And let the record reflect that Mr. Angelo was also answering questions, because you never said who you were. Okay, and Commissioner Sachs, your light is still on.
Thank you, Madam Mayor. We were talking about the location of your trucks, and you were talking about you had a number of them dispersed in various locations before. Do you intend to do the same if you're selected as one of the providers, sir?
Exactly the same.
Okay, so it's not going to just be one general location. You're going to have it all over the place.
That's correct. And we will also implement liaisons into the system, so hospitals, nursing homes can deal with a live person and help facilitate be more efficient, make sure paperwork's ready, et cetera.
And same question I asked everybody else. What do you intend, or what are you doing now for our community?
You want to talk about the community? Yeah.
In 2 minutes, Mr. Angelo.
Less than 2 minutes.
1
minute. I'm currently on the board for the Friends of the Fisher House. Every year I have a Christmas party for them. We're building a new house this year. We're also going to team up with Career Source and bring those kids on. That'll come out of our community pockets. We mentor a lot of kids around the county. We've already given out, without even being here, I think 6 scholarships in Delray Beach at a recent volleyball tournament there through the police. They were all police kids. We gave them the scholarships there to hand out for kids who want to join the EMS field. And we're going to continue this strong work. I've done a million things here in the county on the Homeless Coalition board as a co-chair, I think 3 times. I'm always raising money for that organization. I think it's important. Our homeless community, I worked at a fire station for 14 years that had probably the most homeless right on Lake Worth Road. And I'm proud to say I knew every one of them by name by the time I left there. And a couple years later, I was on Southern Boulevard and ran a call, and some of those people came over and were trying to hug me on the call. And it's important that we know the community, the stakeholders. We're involved in the Delray Alliance, COBRA, West Boca Community Council, our Century Villages, up in the north end, the NACO folks there, or not NACO, North County Alliance there with our friend Tom.
North County Neighborhood Coalition.
That's it. Yes. And we're going to stay involved in that, you know.
Very good. Thank you. And then either one of you could answer this one, but what's the one thing that really sets you aside from the other applicants today?
We're Palm Beach built. Every person on the team is here. I have kids who went to Palm Beach schools. Bill's kids went to Palm Beach schools. His son works at Palm Beach County Sheriff's Office. We're here. We're already doing business here in the county, and that's our focus. Is when we started this company and started saying, what are we going to do? We want to have our home base, a world headquarters right here in Palm Beach County, and continue a very high level of service. I come from fire rescue, which you guys know is the highest level of EMS care. Charlie's back there, Phil's back there. These guys are doing an amazing job, and that's what is bred into myself, is to do the best job you can possibly do.
Thank you. Okay, next. I believe we have a representative from HEA Hospital.
Jason Kimball, he's here.
Yes.
Good afternoon, Madam Mayor, esteemed members of the County Commission and staff. My name is Jason Kimber. I'm a resident of Jupiter, Florida, and the Chief Executive Officer of HCA Florida Palms West Hospital. I stand before you today representing all of HCA Florida Palms West Hospital, and also to include the market hospitals within the county, to include JFK hospitals, the community access points, and freestanding emergency rooms. As many of you know, HCA Florida Healthcare is a vital part of Florida's healthcare landscape, with over 49 hospitals stretching out from Pensacola to Miami. In Palm Beach County, HCA has served the community proudly for 40 years. We employ over 7,000 dedicated professionals and serve as a significant economic engine to our community. Each year, we provide high-quality emergency care to over 194,000 patients and care for over 54,000 patients who require admission for a wide array of clinical needs. These numbers represent your constituents, your neighbors, your friends, my family and yours, who deserve safe and reliable healthcare services. Today, I want to highlight an urgent issue that impacts our community's health and safety. Over the past year, we have worked diligently with staff to provide volumes of hospital data that underscores the dangerous situation patients are facing across our county. What we found is absolutely alarming. When patients require emergency or immediate transport from one hospital to the next for life-saving care when seconds count, the current system fails time and time again. This has forced some hospitals like ours to activate the 911 system out of sheer desperation, a situation that is simply unacceptable. HCA has a proactive solution to this problem. We propose leveraging our ambulance transport division to deploy ambulances directly supporting our network to meet the emergency and immediate transport needs of our patients and your constituents. This model has worked effectively across 17 counties in the state of Florida where we operate. The same exact model. We believe it'll be effective here in Palm Beach County. Unfortunately, when the county staff assess which agencies should be granted a secondary COPCN, the critical segment of high acuity, emergent, and immediate transport was not able to be a priority. Thankfully, your appointed EMS Council of Experts identified the overwhelming need and support of HCA's request for a secondary COPCN. Our unique model would be able to deploy ambulance staff with trained ICU nurses, neonatal nurses, pediatric specialists, respiratory therapists, physicians, and specially trained paramedics. As a paramedic of over 25 years, a former firefighter, flight paramedic, and an EMS chief, I offer a unique perspective. I urge you to accept the EMS Council's overwhelming recommendation to grant HCA Florida Palms West Hospital a secondary COPCN. Our request is a mirror image of the secondary COPCN issued to the healthcare district. This precedent was set to allow their system to move patients safely and effectively. Thank you.
Thank you. Commissioner Baxter, Vice Mayor Baxter, your light is on.
Thank you, Mayor. Hi, how are you?
How are you?
I'm great. So what you're saying is let me ask this, would others be able to service your hospitals?
Yes, ma'am, absolutely. So we're talking about the 15% of patients to where you can't afford. There's no chance, there's no room for error. So this is insulating our patients, which is a huge number, from our freestanding ERs, moving from one hospital to the next. We would still be dependent upon other agencies to do the non-emergency things. But when we have a heart patient that needs to go from a cath lab to open heart, or a pediatric patient that needs to move emergently, or if we need to back up and support Belglade or what have you, because we're the safety net hospital for an at-risk and safety net hospital. We've taken 1,900 transfers a year from the western part of the community.
Thank you. And also, what were the average response times for the secondary COPCN that's currently in place to get to your hospital to transport those heart patients?
What would it be?
Like, how long would it take them to get there
Yeah,
to
so
provide
what-
that transportation?
Yes, ma'am. So what we would propose, we'd start out with 3 ambulances for which we've already got the assets. We would keep one at Palms West.
I think you're misunderstanding my question. You want to do this yourself.
Right.
What's the problem you've experienced to make you want to do this yourself?
Yeah, so great question. So reliability. So these agencies that you see up on the screen, they're planning for one ambulance to come on to do 10 or 11 transports. When they get the call saying that we've got a critical patient, We need them right now. So the reliability needs to be within 15 minutes or so. We need to know that an ambulance is coming so we can package the patient up and move them to higher level
What
care.
has it been? Obviously not 15 minutes.
Yes, ma'am. So, I mean, I've got the data here. It's been, the reliability is about 47%. So if I had a coin and I flipped it, you have a 50-50 chance. If you've got a brain bleed in the ER, a heart attack victim, to move that patient, 50-50 chance.
Please forgive me, but I must be asking this question wrong. I'm asking about timing of the response to get to you. So from the time you pick up the phone and you say we have a critical patient that needs to get to you, what is the average response of them getting there?
Yeah, I mean, I don't have the average response time. I have it more of a fractal response, meaning that if I have an immediate need right now to move a patient, they have 30 minutes to get there. And so from a fractal perspective.
So you're saying they only get there roughly 40% of the time within that time frame?
Correct, because we don't use average, it's fractal. So it's 47% of the time they're there.
Thank you for explaining
I was probably
that.
answering it not very good. You were asking it right. So.
So also, would your vehicles service other hospitals or emergency facilities?
We could in a state of an emergency or those sorts of things, but because our volume's so high and the acuity is so high, now we could certainly if needed to, but we would not take a competitive approach because this isn't a top line. We're not trying to grow revenue here. We're trying to insulate risk.
Nice. Well, and those are my concerns. You know, I don't want, if you are providing your own services, you know, my concern is that it cuts off any other companies. It takes HCA hospitals completely off the board then, right?
Absolutely.
So thank you for answering that question. And also, in an emergency circumstance, being able to maybe provide some emergent backup and, you know, those things that occur not every day or every week, but maybe every few years, every, you know, transportation device helps.
Absolutely. And we have 50 ambulances in the state of Florida, and I can see a case to where if Lakeside needed to transport a patient, it's critical, the aircraft can't fly, we could support them. We're already taking in 1,900 transfers from that critical community in the western part, and we could certainly be a great partner and would be a great partner as we have been for 40 years in healthcare.
Well, I appreciate you answering my questions and taking the time to be here.
Absolutely. Thank you.
I just wanted to point out, considering Vice Mayor's line of questioning, that we can put conditions on the COPCN, for instance, and say that this COPCN would be limited to hospital, business, and emergency situations.
May I go right in? I would like to think we're heading towards more competition, which will solve itself. So thank you.
Thank you. Commissioner Sachs. Commissioner Flores, you're going to go after Commissioner Sachs?
Oh, we go Flores and then Sachs.
Oh, okay, Commissioner Flores.
Sure. All right. Where's your current headquarters? Where are your current headquarters?
So our transport division is down in Broward, but because of each of our 17 operations across 17 counties in Florida, they're so specialized to our network. They would be based out of Palms West, but we would deploy 3 different locations. The headquarters locally would be in Palms West in Loxahatchee, but we'd have a unit over in Palm Beach Gardens and one over at JFK, Maine.
And you're requesting to have 3 vehicles. You were mentioning earlier that you were planning on having one at Palms West, and can you expand upon that?
Yes, sir, absolutely. So we would have a critical care ambulance. So we'd have a larger ambulance equipped to do neonatal because we're a level 3 NICU. So our team would be trained so that bigger unit with all more advanced equipment will be based at Palms West for a couple reasons. One, to support neonatal transports. If we need to go get a neonate and bring them back, our team's going to be trained on the operations of the unit. Then additionally, our hospital doesn't do comprehensive stroke and open heart. And so if we need to move a patient that requires that service, it's best to have them at the lower acuity hospital and transport to JFK. But 3 is our starting point. As the gentleman mentioned earlier, really there needs to be a unit hour utilization, kind of this deeper dive into the number of ambulances and where they need to take place and be deployed. We would go through that same exercise.
Okay. And those, in your application, you stated that you want to start July 1st. Are those ambulances on hand already, or?
Yes, sir. Actually, we can start as soon as the license gets back from the state. We didn't want to overpromise and underdeliver because we don't have assets here, but we have 50 in Florida that we could repurpose after the COPCN is granted, whether it's a limited COPCN. As soon as we get the license back from the state of Florida, we're going to be able to operationalize and begin those transports. We've already got 10 ambulances earmarked for this county. 3 will be deployed here right now, but we have 10 that we can scale up to if needed.
So one additional question, because you are a hospital, how would you prioritize when you're going to use your own ambulance or you're going to call out for a third party? So can you walk me through that decision making?
Yeah, that's a fantastic question. So it's the 15%. So in this document, I show a full year of transports, and when you double click and you pull out the higher acuities, it's about 15%. For example, if I have a patient in my cardiac cath lab that we're doing a cath procedure and that patient needs an emergent open heart procedure, or if a patient presents with signs of a stroke and we find out it has a bleed, those patients are the ones that we're aiming for. Or a high-risk OB patient that's in Belglade, we would mobilize our neonatal team, our OB team, to do those transports. So 15 out of 100. The rest of the 85, we're going to need agencies just like those on the board to transport patients from the hospital to a nursing home to free up beds.
So what happens if your ambulance is not there?
We rely on our partner. So this is going to continue to be a partnership just like it is now, but we're going to insulate and try to do the best we possibly can to meet the very high acuity needs, but we're still going to be dependent upon our partners in the community, whether it's 2, 4, or 6. It's going to be a partnership. We're going to need them just like they need us to not call them when it's 7 or 8 drips on a patient and ventilated with chest tubes.
Thank you.
Yes, sir, absolutely.
Commissioner Sacks.
Okay, thank you. You're a hospital ambulance, and it appears to me from your discussion that you have a very high level of care for those patients that have serious medical issues. Would that be correct to say, sir?
Absolutely. That is our
That's
aim.
your specialty? That's
it.
really your specialty, isn't it?
Right.
And as you responded before, are there other, you were talking about whether your hospital would also rely on your partners. Are there some partners that you would rely, that in your experience are more reliable than others that you have used in the past here in Palm Beach County?
Yes, sir. Yes, ma'am. In Palm Beach County, there's really one, AMR and medics are the same agency. And for the most part, for the majority of the cases, even when you shift around and negotiate the transport, it's adequate. But it's the ones where there's no room for error that has been a significant fallout. And those are the ones that we, and I'm sure you don't want to because it's your family and constituents, want to make a decision to do everything you possibly can, especially when we're seeing almost 200,000 patients a year, to insulate that risk. There's been some significant near misses, and I don't rest well knowing that we don't have another solution for high acuity transports.
Would it be fair to say, and I don't know, maybe I'm ask staff, would it be fair to say that if there was an acute issue, a stroke where minutes were important, or a pediatric patient that needed immediate care, that it would be better to call an ambulance or a provider that had that type of background rather than one that was predominantly in transport of non-acute patients?
So all of the providers, well, let's talk about the current providers. They have skilled staff to be able to transport these patients. So if somebody was, if a truck was not available, then they could always call 911. But, there's a requirement pursuant to the Florida statutes that all of the paramedics and EMTs on these trucks are required to have. And so in order to get a state license, they first have to get a COPCN, and then once they are issued a COPCN from that county, they are required to go to the state and get an EMS license. And there's requirements that are outlined in that license that they have to meet in order to get that. So
Do we make, oh, I'm sorry, go ahead.
No,
Do we have requirements that each truck for each provider have the same capability for patients, whether it's a brain injury or just a transport from a rest home to a condo or something?
So they have to have the ability to run our 6.1, 6.2, and 6.3 calls, which are priority one, our traumas,
Okay, so they're all
and our
equipped.
pre-scheduled. Yes, they're as a COPCN holder, they're required to run all of those calls.
Okay.
They can't pick and choose.
Thank you. I was wondering because in your discussion, sir, you seem to be really focused on those injuries that are acute. One last question that I've asked everybody. Is there something in particular about your company that would place you apart from the other applicants?
Yes, ma'am. For one, we've been in this community for 40 years, and I know Stephanie's response is that they would have equal talent. I've worked at the highest level on a helicopter for a trauma center. We have the knowledge, skill, and ability and the resources to safely and effectively transport these patients to where any of those can come up here and comment behind this, but it's impossible to think that just any ambulance on any rotation is going to be comfortable taking a high acuity pediatric patient with chest tubes or an adult patient, a cardiac balloon pump, to another hospital. It's just absolutely not safe. And we have the resources, we have the data analysis to share data, and we have the commitment to the community to be here long term.
Thank you. Commissioner Powell, I'll get to you in 1 second. What is required in the way of personnel per ambulance?
An EMT and paramedic are required on the truck. I don't have the specific, Lee, do you have the specific requirements when it comes to staffing?
Is it 2 or 3 on a truck?
At least 2.
Okay.
And then they have to have a certification and also supplies on the truck.
I'll come back to you. Commissioner Powell.
Thank you, Madam Mayor. The situation with HCA, you're kind of unique in terms of what you're offering to provide. It's almost like it's a boutique. The question that I have is, with regard to being able to provide service, what about the concern that you all, and this could be a concern, would be able to pick and choose because you're still working with other providers to provide service to your hospitals, but to be able to pick and choose the patients that you choose to serve, non-acute or the indigent. Is that a concern, or what currently happens? Are you all servicing everyone, or is there a higher likelihood of your services, and it's only 3 ambulances proposed, only serving those who can necessarily pay, which would put others at a disadvantage?
Yes, so great question. And I would just point back to how we currently serve the community today. We are based in Belglade right now, providing GI services, OB services, general surgery, regardless of the payer dynamics. We are the safety net hospital for Hendry and Lakeside. We take in 1,900 transfers a year. We pick up when we answer the phone, we say yes always. We train Belglade's or Lakeside's GME. We stood in and bridged that program. We would take the same application of what we do each and every day to care for and improve human life, regardless of their ability to pay. But I could tell you, I'm proud of our underserved and underinsured commitment that we do each and every day across the state of Florida, and we would do the same thing here. Because for us, it's not a top-line issue. I mean, we're going into this knowing that I don't care if I lose $1 million, but if I save a life, it's absolutely worth it. The other agencies, I've been in the business for over 25 years. There's a top-line focus there. For us, it's a person with a real name, a mom, a brother, a sister, a daughter. That's what it's about for us. This is not a top-line issue. This is a rounding error on the top line for us.
So it's safe to say that's not a legitimate concern for you?
Absolutely not. Our focus is the person that needs us when seconds count.
Thank you.
Yes, sir, absolutely.
Thank you. Back to Commissioner Flores.
So, going off of Commissioner Powell's comments, picking and choosing, when I look at your pricing structure, you're by far one of the most expensive transports out there. I'm also concerned that you will pick and choose which ones you want to transport because you stand to make a little bit more money. When you only have 2 ambulance running and one as a backup, I find that a very weird model. And I worry about making sure that you have sufficient staff to run 2 ambulances. And then my other concern is your commitment to providing a service. And we had this conversation. You recently decided to pull out on minors under 12 providing mental health care. Right. How do I know that you're in this for the long haul and that you're going to be a good business partner and you aren't going to pull out like you did for mental health?
Yes, sir. I'll go to your first question about the pricing structure. That was a standard analysis we used based on Medicare allowable. We would concede to whatever the average is. Again, that's not our focus here at all. That's number 900 on the list. Now, our focus is on the patient in the middle of the problem. Again, the 15%. And we've proven our commitment to the community in our outreach, in our commitment to out west. I'll go back to the issue on the JFK North piece of it. We've been here for 40 years, and decisions that are made, just like the one that you're talking about, is it a vulnerable decision? Is it a tough decision? Absolutely right. I wasn't in the center of that, but what I can base my confidence in is saying that there was extensive amount of study and burden that went into that. That's one very critical issue. I'm not underestimating that at all. What I would ask you to do and really beg you to do is take a look at 40 years of commitment and what we've done to elevate healthcare across Palm Beach County with the scores of patients that we take care of every single day.
Thank you. Vice Mayor Baxter.
Thank you. As somebody who was in the healthcare for 10 years, I think one of the things that need to be kind of discussed that wasn't discussed too, Commissioner Flores's questions about pricing and just picking the most expensive trips, let's say. Generally speaking, in healthcare, the highest paying items are going to be of highest critical need, are they not?
Right.
So, yes, this is designed to do that, but because it is every second counts, that's why it costs more. And the level of service that would require, and sometimes the equipment that goes with it, and the level of healthcare providers that also go along with that, would that not also make it more expensive than somebody who can wait an hour to get picked up and transported?
Yeah, I mean, for us, some of the transports, if not a large number of the transports, we are actually financially responsible for. So these freestanding ER transports back to our main hospital, we're responsible for that. So we're not even charging the patients, for those at all. And as far as the model is concerned and the price point, our critical care nurses would be on call within the building. Our critical care paramedics would be on call within the ER. So when we have a heart attack victim come in at my hospital and they need emergent transport, those are the ones that are mobilized to transport. That's why going back to Commissioner Flores, it's a unique, it's very unique because we're not out there trying to, beat the bushes to get every single transport. This is very narrow and there's no screening as far as payers are concerned. We're going to transport the high acuity ones or the ones that need to be moved to open a bed up.
And I appreciate that. And I think if it was my mother, grandmother, sister, you name it, in the hospital with every second counting, I would want the availability of that service. So I do thank you for taking that into consideration and coming here.
Yes, ma'am, absolutely.
Commissioner Woodward.
Yes, thank you, Mayor. Just one question, one comment. You have good data. I know when we met, you came with a file folder full of,
yes, ma'am,
of numbers. So I'm curious, are you able to somewhat predict how many calls, because this is just emergent,
yes, ma'am.
So how many calls are you expecting on a weekly basis or daily basis?
Yes, ma'am. So we're looking at overall for the course of the year about just under 1,000 transports. That gives you an idea. And I'm putting on my 25 years experience in EMS, public sector, private and federal. No one in their right mind from a business acumen perspective would go into anticipating 1,000 transports a year and expect to be financial. So that's what we're estimating. So roughly about 3 or 4 transports a day. That could shift, as the Commissioner was stating earlier. 1.5 million constituents full time. It'll 6x, 10x that during the season. We may experience more of those types of transports. But overall, you're not talking about a tremendous amount, but it's enough to where we can't afford to be responsible for not having the right service there.
And pardon me for not being super familiar with your particular network, but you said you're a receiving hospital. Are you a trauma hospital, or you need to take patients to a trauma hospital?
Yes, ma'am. We're not a trauma center. I'm here representing all of the HCA Florida hospitals within the county, to include the freestanding ERs. And so my hospital in the western part of the community is largely a women's and children's center. That's why I'm not resting well at night, because these patients oftentimes have to be moved. We requested a transfer in December from my hospital to Winnie Palmer on a Friday that they couldn't come in until Monday because they didn't have staff they felt comfortable enough to do the transports. JFK Hospital does open heart, they do comprehensive stroke, but they don't have GYN services in obstetrics and pediatrics. That's where the model is. You base an ambulance there to move those patients, and we move the heart victims and the stroke patients back and forth. And JFK North is a progressive hospital, largely behavioral health, but they're doing a lot of surgical cases too.
Okay. That's all. Thank you.
Thank you. Commissioner Sachs.
Very quick. You're Dr. Jason Kimbrell,
Yes, ma'am.
and I didn't realize you were you're a medical doctor.
I'm not a
sir?
physician. No, I've got a doctoral degree from the University of Alabama at Birmingham.
Oh, okay. And you are the CEO of the hospital system.
Yes, ma'am.
And yet, JFK is one of the largest hospital. I think it is the largest hospital in the county. Is it not?
Yes, ma'am.
I'll call you doctor, I guess.
No, please don't.
And yet and I thought you were just part of you were not part of the entire system of the HCA. And I had a wonderful conversation with Ms. Turnbull the other day. Will you consider to review your records with regard to not accepting our children for Baker Act?
As I committed to Commissioner Weiss the other day, my wife's a therapist. While we're in here, she's doing therapy in a full. So that's a tough decision for everyone involved. I'll commit to whatever I need to on behalf of the organization for better understanding, transparency. If there's another option out there that we're able to evaluate, I'm committing, just like I did the other day, that I would provide that time and usher those that need to be at the table there.
Because you want to be a good partner here in Palm Beach County.
Yes, ma'am. This is my community. I mean, I'm here passionately trying to advocate for a need that I believe in. This is not financial for us, and same is true on the behavioral health side. That's
very
hard.
happy to hear that, because this morning a child
Yes,
had to be transported to Martin County.
Yes, ma'am.
She was a Palm Beach County child because we don't have a hospital here that takes care of it.
Yes, ma'am.
So it's kind of personal to me, too.
Yes, ma'am.
And I'm sure to many residents and children and families. But I'm glad to hear that you are going to commit to being a good partner here in Palm Beach County.
Absolutely. Yes, ma'am.
Thank you, sir.
Okay, thank you very much, Commissioner Sachs. And we now are going to, where's my little, yep, E-Care. I'm sure we have someone from E-Care here.
Call them or just wait?
Okay, sir, your name, please?
My name is Mike Arguelles. Good afternoon, Mayor, Vice Mayor, Commissioners, County Administrator, and staff. My name is Mike Arguelles. I'm the COO of eCare Ambulance. I chose to work at eCare Ambulance to help improve emergency medical services by building an ambulance company that invested in their people and equipped them with the best resources and latest technology. We bring over 250 years of combined EMS experience. Our management team has extensive expertise in serving populations of over 1 million people. What truly defines a company's experience is the expertise of its staff. We have 45 EMS professionals ready to begin service immediately. We also have over 70 job applications from Palm Beach County SEP's residents in the currently in the interview process. Our base of operations would be located at 1109 South Congress Avenue, where we're going to establish our headquarters. Our local emergency medical dispatch center is already operational at this location, featuring innovative technology, including real-time application for hospitals to track unit availability, ETAs, and request service. We're happy to provide the county with dashboard access to monitor our performance in real time. eCare has made a significant investment in 25 fully equipped new ambulances. Mrs. Serrano, our CEO and owner, is asking this board for the same opportunity that was given to some large EMS companies that started small in their counties and grew into their communities. eCare currently operates in 2 counties and provides statewide support during critical situations, including natural disasters. Our track record speaks to this experience with a proven history of enhancing ambulance services and improving the quality of life in the communities we serve, as attested by recommendations received from the Mayor of Monroe County and Chair from the Citrus County Commission. When it comes to market saturation, it must also be weighed against the growing demand for ambulance services in Palm Beach County. More providers mean better service, faster response times, and enhanced public safety for both residents and the tourism industry. Awarding eCare Ambulance a certificate to operate will not only foster competition and improve service delivery, but also support a locally owned small business contributing to economic growth and diversity in our community. Small businesses like ours are the backbone of our governments, local governments. Having dedicated ambulances available year-round to ensure reliable emergency medical services for Palm Beach County is critical for public safety. eCare is a local experienced business ready to meet that need. Thank you for your consideration.
Thank you. Commissioner Flores, your light's not on, but I know you're going to go, so. And Commissioner Sachs to follow.
So basically the same line of questionings that I asked the other applicants. Where is your headquarters?
Currently now in Monroe County, but our goal is to move it here. Our president is a resident of Palm Beach, and that's kind of been his vision to create the headquarters of our company in Palm Beach County.
And I see that you guys have 25 ambulances committed to the county. How did you arrive at 25?
We did an assessment, we did surveys, we went to different facilities. We also found there was a certain segment of the population that was being underserved. You know, you have people in houses on ventilators, so it's not just the hospitals, it's just other people that need medical attention during transport. So we not only looked at the hospitals, which they do have a huge need, we did see that as well, but you have nursing homes and you have more medical centers coming on board, plus the other people that have that need that are not necessarily in a hospital but still need medical attention during transport.
And those ambulances, where are they now?
Currently in Monroe. We have them in Monroe, but if we're lucky enough to be awarded, we would move them to Palm Beach County. We already have a location
we would just move them there.
And those ambulances are dedicated for Palm Beach County, or are they going to be shared?
No. Those would be dedicated to Palm
Dedicated
Beach
to-
County. That's what we put in the application, that they would be committed to Palm Beach. We just don't have them here now, but we have them ready already. We've been stocking them and then getting them ready.
Got it. Thank you.
Thank you.
Commissioner Sachs.
Thank you, Madam Mayor. Good afternoon, sir.
Good afternoon.
And I'm going to ask you the same questions I asked before. And that is, what currently is your business doing in the community? Or since you're brand new, what would you commit to doing in our communities?
We're already serving the community, as our owner is a Palm Beach County resident, so, even before we got our licenses, we already have, a scholarship foundation program with the Community Foundation already in place. We're meeting with different local schools, like Palm Beach Lakes High School and other high schools within Palm Beach to give them access to that scholarship program. And we also are working with local colleges like Palm Beach State College to bring these scholarship funds that we have already in place to work with local residents and local schools to enhance emergency medical services in the county.
Not to add to that, but you do work with low-income families, veterans.
We also have our fee forgiveness program where we help those that are unable to afford rides, not only for low income, but also veteran status, to make sure that even those that can't afford it still go out and look for health care, which is so important for everybody.
What is the one thing that sets you apart from the other applicants, sir?
I think our focus on service and our people, we like to invest in our people, pay them correctly, and equip them to be able to provide the best level of service. And ultimately, our focus on ensuring that we're being the correct partner for our hospitals, and not only the hospitals, but any other partner that we have out there, to ensure we're an extension of them, so our service reflects on them. So our focus is to make sure we're providing on-time performance, and we're constantly analyzing, meeting with our customers to ensure that the expectations are being met and we understand what their needs are, so we can continue to work hand in hand with them in enhancing our services and whatever else we need to improve on. If it's, they need, anything as a partner, not necessarily only in the ambulance side, but making sure we have also community involvement and making sure we understand, that we're being a good partner to them as well.
Any other commissioners have any comments or questions? Okay. Anyone here from Rapid Response?
Thank you.
Did you fill out a card?
I did not. No, I'm sorry.
So when you're done, please state your name, and then when you're done, please fill out a card.
Yes. My name is Felicia Partnev. I'm here representing Rapid Response Medical Transportation, also known as Rapid Response Ambulance. I'm so sorry. I never grew into the height I was supposed to.
Go right ahead. It's not going to stay. You just probably have to hold it. Thank you.
Yes. Thank you for having me here today. Rapid Response Ambulance is the newest kid on the block here. We are the youngest company. We are growing. We're looking for an opportunity to grow even more. I will say that we transport 90% of our patients into West Palm Beach County. My crew, my boss, the owners, they do know people at facilities at Palms West, at JFK, at Wellington. We transport a lot of patients into the county, and we would love to have the opportunity to help patients go to their next location, be that home or back to a facility in one of the other counties that we provide services to.
Anything else? Any questions from our commissioners? Yes. Commissioner Powell, Commissioner Baxter, Commissioner Flores.
Thank you, Madam Mayor. Thank you for joining us today. Is there a reason that we don't have any information with regard to the number of urgent transports that Rapid Response Medical Transportation does? You would think if your name is Rapid Response, you would have a response to the number of urgent transports that are.
When you mean urgent, do you mean critical care?
That's within 30 minutes of the agreed upon time, 90% of the time, urgent transport, which is not pre-scheduled.
I believe we did give that information. I will say in one of our counties, we are based at the hospital, so our response time is less than 10 minutes. In other counties, it's also 10 to 15.
Thank you. Your principals, they're not here today.
My father's the owner of this
Okay.
company. Unfortunately,
Okay.
we felt that it was better not to get everyone sick here today.
Oh.
So I'm here representing him. I'm sorry.
No, that's great. That's helpful. In terms of you're one of the newer companies, how many employees do you have, and what's the level of upward mobility? And then same thing with Commissioner Flores will ask you about the trucks.
Right now, we have 50 full-time employees, and we are constantly hiring.
Perfect.
We are constantly hiring. Our level, we can do BLS, ALS, critical care. We can do pretty much anything any other ambulance company can do. We're just smaller.
Okay, thank you.
Thank you, Commissioner Powell. So I am next on the mayor's list, but I'm going to skip myself and come back to me, and I'll let Commissioner Flores go first.
So the same questions that I've asked everyone here today. Where are your headquarters?
Our headquarters are in Sunrise, Florida, in Broward County. That is where our dispatch center is. That is where we do staff meetings, trainings. We do have an office in Hendry County and in Highlands County.
Thank you. And on here on the application, you put 3 to 4 vehicles in Palm Beach County. You didn't really give a breakdown. What would be that breakdown, and why are you recommending 3 to 4 to start out with?
It's 3 to 4 to start, obviously. We do have about 7 ambulances right now. 3 to 4 would be dedicated to Palm Beach.
Okay, and those 3 to 4, where are they coming? Where are they right now, and where are they coming from?
It's an excellent question. I have ambulances scattered. I have some in Broward being stationed, being worked on, being wrapped, and I have about 1 or 2 each in Hendry and Highlands right now.
Okay, so you're going to pull from them to bring some here?
Well, they're just there in the case for backup. We have several backups, but
Got it.
it wouldn't necessarily be pulling resources.
And my final question is, on the application requirements, you guys failed to submit, I believe it's the last 3 years of audited financials, which is item number 12. What happened?
I don't want to step on any toes. We did submit financial documents. We did submit them. I don't know if it was a situation where we submitted them a little bit late, because I did submit the application with certain documents, and then I had discussed that they needed more information, and I did submit more. I don't know if it's a fact that it was a little bit late, or maybe it was just not the exact financial documentation that the county was looking for.
Got it. Okay. Thank you.
Before we go on, Stephanie, do you have a comment?
Yeah, so just for a point of reference, we did review those, and they were not audited. We had our Director of Finance for Public Safety review that information, and they were reviewed but not audited. So there's a whole level of detail behind audited financial statements, and that was not conducted.
Thank you. Commissioner Baxter, Vice Mayor Baxter.
I want to say thank you for coming here today. One of the things that I love to see are young companies and entrepreneurs trying to get into, I'd consider this a very large county world organization, all the above, and to come and step in for your father. So good for you. That's amazing. And I'm sure this is the last place you want to be in the hot seat, getting all these questions.
No, Miss Baxter, Miss Vice Mayor, it's a great place to be. I'm learning a lot. We learn together. We are a very hands-on company. You can find us every weekend. We are at our bases. We're with our crew. We are very hands-on. That's what sets us apart. every ambulance company is an ambulance company. There's not much, playroom there. But my father worked 30 years as a New York City 911 paramedic. He participated in World Trade Center 93 bombing, obviously 2001, 9/11, Hurricane Sandy. We've been there together through everything. He's the first healthcare provider in our family. So, this is a dream come true in the making. And sometimes it works, sometimes it doesn't. It's a learning process. I understand that. We understand that as a small company.
So one of the things, we have this little checkbox here that was on slide 21. There was just one yellow box for your company of the audited financials. Would you care to elaborate on that at all?
It is to my understanding that the financial audits, and I, of course, don't want to step on any toes on anyone in the county, that the financial...
No, please do.
No. I was raised to respect everyone in the room. I do not like stepping on toes. That the financial audits that the county would require were probably more elevated than anything we would have had done because we're such a small company. And it's not that the finances we put in the company are small, it's that it's just, in comparison to the bigger companies in this room.
And thank you for that. And I thought that's where you're going to go. A smaller company, which most people in here know, I'm a small business owner myself. We don't just have audited financial reports
correct
on hand. And I would still love you to be able to participate in a program. And to the point of what's been made, we have 2 years to collect data and information and see how anyone performs. So I just want to say thank you again for coming and speaking and being here.
Oh, no, thank you. I really appreciate the opportunity. And hopefully in 2 years.
Thank you. Commissioner Sachs?
Thank you, and thank you. I think I saw you walking into the parking garage this morning.
It's very possible.
I think so. I was right behind you.
It's very possible.
I'm going to ask you the 2 questions that I asked everybody, and I know you've had an opportunity to think about them. So, and I know you're very service-oriented as a family. What would you do as a company if you were chosen to serve here in Palm Beach County?
What we would do in regards to giving?
Yes.
Well, we proudly hire military vets. About 25, if not more, of our crew are military vets and active military. We do a lot of my crews. They love outreach, anything with children. We donate books. We love to give toys to children in hospitals. They are very, very committed to animals who don't have homes. So there is that. We do love to give in any way we can. We do love to work with local colleges and career centers. And we like to elevate people from inside our company. We do really encourage them to go to school. Anybody who wants to go to school to become a paramedic, we obviously help in any way we can. We do have an emergency fund for our employees because we know what it's like to live, maybe paycheck to paycheck, or maybe someone got sick at home. We do understand the merits of that.
That's very good. Thank you. That's a very good answer. Would you say that was what you just said was probably one of the reasons why you stand apart from other companies, or is there something that you would like to add?
Yes, ma'am. I do think that's one of the things. We are extremely hands-on. I spend my weekends and my night times, if I'm not on the phone with crews, I am there in person. They do know us. They have a direct number to us. Anytime when we bring new people on board, the first thing we tell them that is, if you're ever in a situation where you have to treat a patient that you're not comfortable with, please pick up the phone and call us. Please let us know, and we'll figure out how to transport that patient safely. And if there's a situation where the patient cannot be transported safely, they should feel safe in knowing that we, as their guiding hands, will protect them. Because healthcare is really about protecting people.
All righty. Thank you very much. Make sure you fill out a card. Yes. Thank you. Now, we actually do have 13 other cards. If you would like to speak, we're going to give you 2 minutes each, but it's not going to be a question and answer from the board. That part of the conversation is over. Can we go, no, well, I said in the beginning for 2, but you don't have to take all 2 minutes, and I think maybe some of you have already spoken, so let's go ahead.
We have Mayor Ronnie Felder, Alexandria Larson, Rebecca De La Rosa, and Matthew Johnson. You have 2 microphones. You can come up, please.
Yes, I was going to say, feel free to wave in support. Say what company and wave in support. Go right ahead, sir.
Good afternoon. My name is Matthew Johnson. I'm the Director of Operations for HCA's Medical Transport Division. I'm going to yield back your time to you and just say that I ask you to approve our application.
Thank you very much. We like that. That was nice and brief. Ms. De La Rosa.
Yes, thank you very much. Mayor, Vice Mayor, Commissioners, thank you very much. We are in full support of, as a representative of eCare Ambulance, supportive of their community outreach as well as the programs. One program that was missed on one of our presentations was simply the efforts to cover opioid recovery, and we have been working with a behavioral health group here in Palm Beach County to do that. So that is the additional program that we wanted to mention. And then in addition to that, as a local hospital, we support HCA. So thank you very much.
Thank you. Mayor Felder, did you want to get up? Let the record reflect that we have Mayor Felder from the city of Riviera Beach here.
Good afternoon. Yeah, kind of surprising. I didn't know I was going to be able to speak, but I'm here in support of E-Ambulance. After meeting them, one of the things that resonated with me was their outreach. As we sat down with them, what we know the importance of getting our young kids opportunity. And after sitting down with them and knowing their plan to come out and do outreach in our community, really bolstered our support for them. And also, they're also going to put an office in Riviera Beach. And so I'm just here. I yield back my time in support of E-Ambulance. Thank you.
Thank you very much. eCare.
Okay, we have Brooke Little, Carrie Edison, Nisha Mills, and Damon Barrett.
Why, thank you, Damon. So I'm Carrie Edison. I am the Regional Vice President of Patient Logistics Center and Medical Transportation for our HCA South Florida region. And so with that, I am a registered nurse with 25 years of experience, predominantly in critical care. I do want to share that my team includes registered nurses, EMTs, paramedics, and other ancillary staff. We're responsible for all patient movement in and out of 30 hospitals of HCA in South Florida. That includes the 3 hospitals here in Palm Beach County, so HCA JFK, JFK North, and Palms West. So as my team's responsible for moving these patients, I do want to say that, again, we want patients to get as quickly as possible to the right level of care. And you've heard that from Jason Kimbrell, our CEO of Palms West, and why HCA Palms West medical transport would be important to us. So I can share that my nurses, when speaking with transport companies, we want to choose, as Commissioner Flores had said, the quickest response that we can get, and that is what our nurses do. And so with that, we don't wait. If it's HCA medical transport that we have in some of our other markets, we don't wait for insurance verification. We don't ask who the payer is. Our nurses call and schedule transport, and the quickest response is who we accept. And so we really want to have that same opportunity in Palm Beach County that we do in other markets to really have HCA medical transport supporting our patients. So thank you.
Thank you.
Good afternoon. My name is Damon Barrett. I'm a resident of Loxahatchee, and I serve as the Chief Operating Officer for HCA Florida JFK Hospital. As Jason has said, and I think it was a really great, terrific discussion, those emergent, immediate transports are the key. We see it every day, and I think the safest thing for our patients are to be able to have a ambulance on site that we can immediately take them to the hospital that they need to be at. Hospitals don't provide all services anymore. If you want to be good at something, we really specialize, and we have a great partnership with the facilities. So our our expected mothers who's in a true emergency comes through JFK's door, we can stabilize and immediately transport to Palms West. And same if you have somebody with a cardiac issue, stabilizing and come to JFK. So once again, obviously, I request that you consider the EMS Council's recommendation to grant HCA Palms West Hospital secondary COPCN, the same has been granted to the Healthcare District of Palm Beach County. Thank you.
Thank you.
Good afternoon. I'm Nisha Mills. I'm a resident of Wellington, Florida, and then I'm also the Chief Operating Officer at Palms West. I just want to say that I do oversee the cardiovascular service line at Palms West, and it is just very important that if we do have a patient on the table and we need that emergent transport, we have that availability for our teams, for our physicians, and our staff, or for our patients. Again, our track will be housed with respiratory therapists, physicians, skilled nurse, the key to what we really need for those critically ill patients, so then we can transfer them to JFK for open heart surgery. Thank you so much.
Thank you. Brief, like that.
Okay, we have Mary Lou Bedford, Javier Alonso, Alberto Naranjo, Jody Davison, and Maria Antunia. Yep. Got a couple. Javier? Go ahead. You can go ahead.
So, hello everybody, Madam Mayor, Commissioner, Senator. My name is Alberto. I'm representing eCare here. Just a couple more highlights. I want to thank everybody that supported us. We have a list of over 24 supporters, and I think that's very important for us. Specifically because of the ordinance in the county, section 1324B states that the commission shall take recommendations from the municipalities. So that means that the staff and the council's recommendation is not the only recommendation that the board should consider. They should really consider the municipalities as well. Just quickly overall, I just want to point out that out of the 5 largest populations in the entire state of Florida, the majority of them have over 6 providers. For example, Orange County, they have 11 providers. And even smaller counties like Monroe, they have 6 providers. Just wanted to say thank you again for your consideration, and we really hope, just to emphasize again, that we support a local resident who has a minority small business, and I think it's very important to support our local people here. Thank you.
Thank you.
Hi there, I'm Jody Davidson from Reuben Turnbull and Associates, and I waive in support of HCA's application.
Thank you very much. We like brief.
Okay, last call for Brooke Little, Alexandria Larson, Maria Antunia, Mary Lou Bedford, or Javier Alonso.
If I may, Maria Antunes send me a text message. She has a family emergency. I can read it into the record. If not, yeah. Let me see where.
Should I start a timer for now?
It's short. Let's see. No, it's not in Spanish. I'm just trying to take out the family stuff first. I apologize. So she basically says, I am writing to you in support of Dire eCare, but my son was diagnosed with cancer last week, and I really can't go today. It's a little personal. Please consider supporting them. He's ready and able to start immediately, and service to Glades with so many Hispanics in Palm Beach County. Please, he's a resident, and I thank you for your consideration.
Thank you.
We also have 10 non-speaking cards that I will enter into the record.
Okay, thank you. Ms. De La Rosa, you
Yes,
seem
I
to
just
be...
simply want to acknowledge that Mary Lou Bedford unfortunately had to take off. So she wanted to express her gratitude for the time. She was here earlier, and that she wanted to support all 5 qualified applicants.
Thank you.
Thank you.
All righty. Commissioner Weiss.
Thank you, Mayor. I have a question for staff as it relates to providing the service to our western communities. So if anybody receives a COPCN today, are they required to service our communities out in Belglade, Pahokee, and around the lake? And what is that?
So once a COPCN is issued, they're going to enter into an agreement with hospitals. So if they have an agreement with Lakeside Medical Center, then they would transport those patients. Right now, as you know, prior to issuing a COPCN to the healthcare district 3 years ago, ANMR and medics were the only game in town. So hospitals had to enter into a contract with them. Now that HCD has worked out an agreement, prior to us issuing them a COPCN, there was an agreement with AMR and medics that they supported the COPCN. So now they transport their patients. However, there has been a period of time that they might need to call AMR and medics, and they would do so to transport their patients outside of or out of Lakeside Medical Center.
So they're not required to have a response time to...
So right now, the way the system works is because AMR and medics are the only ones, they have an agreement with every hospital. Once we add providers, a hospital could pick and choose who they want to have an agreement with. And that agreement then ties them into response times that they have to meet in compliance with the ordinance.
So what if, then, for example, if nobody wanted to provide service to Lakeside or to the... let's say, I'm sure we have also retirement communities out there and people needing transport. If they didn't want to, then they wouldn't be able to get service?
Right now, the way the system works is they don't have to enter into an agreement. It's up to the assisted living facility, the skilled nursing facilities, as well as the hospitals on which provider they'll enter into an agreement with.
And what if none of the providers want to do that?
Again, we're going to see what happens at this point.
I mean, I just...
Right now, the way it works is every assisted living facility and skilled nursing facility and hospital has an agreement with either AMR or medics, which we know they're the same company. I'll just stop talking about them as two.
How do we... I mean... and I'm sure my colleagues have concerns about that.
And the area is countywide, just so I'm clear on that. A COPCN is countywide, but if I can't see that them refusing. I mean, we would get involved in that conversation if that happened, but we've never experienced that. So, but the ALF
in the past, we sort of had a monopoly going on here, and I just want to make sure that as we expand, if we do expand the service, that our residents out in our western communities are also serviced, as well as the folks that live on this side of the county.
So the expectation is that the new provider or the current providers would have to have an agreement if that hospital or ALF is wanting to enter into agreement with them. Now, but the ALF or the hospital does not have to enter in an agreement. But the other way around, we would get involved if they were denying them. I don't think that'll happen, but hypothetically it could. So, yeah, their intent of their application was countywide.
So if we issue, I'm going to look to our attorney. If we issue this COPCN, and it is a countywide requirement, then does that provide enough legal?
It does. If we condition the COPCN on providing countywide services, unfortunately, because it's a contract situation, there is a certain amount of negotiation that they're going to be able to do. But the board would certainly be involved. If we felt that there was no providers or that a provider was refusing to provide services to the western communities, we have the ability to revoke a COPCN. We have ability to suspend a COPCN, so we can tell a provider that, no, it's not okay to provide services only to the East County. So we're going to suspend you until you work out an agreement with the western communities. So we do have things that we can do.
Okay, I just don't want to see a gap form in coverage.
If I may add, The point I was trying to make for a point of clarification is the entity is not required to enter into an agreement with the provider. However, vice versa, because of their application, it was countywide, we would hold them accountable for that. Okay. Sorry.
Great, thank you. Commissioner Flores.
So my comments were going to be the same regarding the Glades region, making sure that that whoever we bring on board or online is going to provide the services out west, and for them not to pick and choose where they're going to work. So if their application is countywide, that is the expectation, and especially since and I want us to collect the data to make sure that they are servicing, because whatever we choose, it's coming back before us in 2 years or whatever that may be. But I want to make sure that when we select whoever we select, they come back, that we are making sure that they're servicing the western communities. The other point, and when I met with all the applicants that are here before us today, to me, it's extremely important that we hire local talent. And I'm speaking to all 6 applicants right now. We haven't made a decision on anything right now, is that we are selecting people from our county that are graduating here locally, that have families locally, that are looking to get into our fire EMS teams. So to me, that's extremely important that they make that commitment to hiring local, and that's something that I want to be able to track as we move forward, because I'm sort of thinking we're approving something today, but it's really a test ground to see who's truly a good partner in 2 years. And that's what I want to be clear, that that's my expectation, is that we're going to hire local talent to fill these ambulances. And my last comment or point is, I always root for the home team, and I like providers that are from here, from Palm Beach County. And I think that matters, and that impacts the local community. So that's something that as we're moving through this decision-making, that I'm going to be in support of.
Thank you. Vice Mayor Baxter.
I have some of the nicest commissioners up here with me, so worried about my western communities. So thank you for that. I do want to say I agree with Commissioner Flores to the point that the 2 years is a test run, right? It is let's see all the promises made today, what comes to fruition, where headquarters are located, how the services are provided. And I can promise you, I won't be supporting anyone in 2 years that doesn't serve my western communities. So there's that. So I don't necessarily believe we need to put any restrictions at this time on the COPCN. I believe that message is going to be sent loud and clear. And we'll move on from there. Now, a few things that I do want to cover and questions I do want to ask staff. So staff has made a lot of recommendations, and some questions were brought up, and forgive me, there's not a nice way to put this, but I mean, really, what expertise does staff have in this area?
So we have an emergency medical services manager that's over the program. He actually used to be a former lifeguard, has worked with Red Cross. He was an EMT as well. We also have our...
and please forgive me, I mean, yes, lifeguard, but like running a business of this sort, there's a big leap there. And even a previous EMS person doesn't actually understand the complexities of a company and how it's run behind the scenes.
Understand. So this is a certification that we issue to these companies to be able to operate in Palm Beach County. I do know that, I've been involved in the EMS ordinance rewrite the first time. I'm involved in the second time. I'm there reviewing the data. I've found that there are gaps in the ordinance, and there are, issues that we have to address moving forward. So it is not a perfect world, but as far as experience goes, I do not have any EMS experience. I am the public safety director, but I can tell you that, he's new on board, so I'm not going to put him on the spot here because he was not involved in the application, but he is our new deputy director for emergency management, and he was the former EMS chief for fire rescue of Palm Beach County.
Okay.
I do know that Mary has over 15 years of experience being in emergency management. Todd Von Laren is, of course, our support.
I mean, in hospitals
but
and
again,
interacting
I am not. I cannot take credit for having that experience. I do the best of making sure that whatever ordinance that you guys have outlined as far as the requirements, that we follow those. I did that. I'm responsible for making a recommendation. That's a big charge. I made the best recommendation that I could, and I considered, key factors in those recommendations, and that's what we moved forward with. Of course, you have another recommendation by the EMS Council, who is another body that has, subject matter experts, people that work in the hospitals, et cetera.
And that's where I was going with it. So you're beating me to the punch, Stephanie.
Yeah, and then we also have our EMS specialist who is a paramedic or EMT and actually does support, services here in Palm Beach County and does all the inspections. So with that, I don't know if I answered your question.
You did.
But so
thank you.
You're welcome.
And you're kind of, to your point, your words, a data person, right? So I love that because I like to dig into data. And I just want to make sure that when staff is giving us recommendations, that they are expertise and data-based and not just why. Like some random number, oh, this sounds good, looks good. Because really what you guys have recommended doesn't match counties around us of similar sizes. So it leads me to why, right? And please don't answer.
No, I just, it's fine.
Rhetorical.
Yeah.
But you get my point. Now, I love the idea, to Commissioner Flores' point again, about having Palm Beach County-based businesses. We heard several promises today about potential for headquarters being moved here, being operated out of here, working with us, so all of that. And, I had a few other comments that I'm actually going to skip on because I think we covered most of it during the questions with the different companies. And I do want to thank all the companies for coming out, answering the questions, being put on the hot seat. So thank you for that. I'm going to state my opinion and make a motion regarding this. So because we only have 2 years, I personally would like to see we have A, B, C, and D here. I would like us to approve all of them. And I'm going to say because I love competition, and I want to see which company thrives and does the best, and which companies don't. I think 2 years is a perfect time period to give us that data back and see how we want to move from there. And we still haven't gone beyond what other counties, with the number that other counties use. I mean, this would be, I believe, 6, in addition to the one we have, which is 7, right?
And healthcare district is.
And healthcare district. And how many does Broward have?
We have that data, but I don't have the number off the top of my head.
Okay. I don't think we're going some crazy number doing this. And I love the idea of a new young company being able to come in. I love the idea of having large companies to support in case there, are some other issues, because I think that's why staff recommended the 2, is because they wanted them to be able to pick up any slack left behind. And there might be some fear of not having enough business for the companies, but again, we have 2 years. Let's look at the data, analyze it, and see where we stand. And so I would like to make the motion to approve 4B1, A, B, C, and D. And that's my.
Can I just put a caution on that? Only because the one applicant did not comply, and there just needs to be a condition that, my attorney's in my ear right now telling me that they didn't comply with the ordinance. So what that condition needs to look like is that they'll obtain audited maybe within?
Yes, you
Okay.
can't just outright waive that requirement of the ordinance.
Turn on your mic, please.
But we can go ahead and put a
Fortunately,
condition
she's
on it.
here. How, can we ask you to come up to the mic, please? And maybe you can give us how long you might need to provide us that information, or if you'd even be willing to.
Hi. I'd be happy to provide you what you needed. I would need a little bit of time, but we would be happy to do it.
60 days, 90 days? What are we talking?
I don't want to make promises
90?
that I can't,
Yeah.
but I can provide it with a little bit of time, and we can be in West Palm Beach County. And I
So-
just want to put this out here because I'm so sorry. I didn't mention this in my original. I was a little bit rattled.
Because you can't give me a date, I will pick a date, contingent upon them providing it within 90 days.
Yes.
Okay? And that would be my motion.
Thank you.
Thank you.
You understand what the vice mayor asked of you, correct? They want,
Yes.
if this passes,
Yes.
you need to give us audited financial statements
Yes,
within
ma'am.
90 days.
I understand completely.
Okay.
And I am ready to provide that.
Okay. Thank you. All right, we got lots of lights on. Commissioner Woodward. We didn't get a second because we're still having discussion, so.
Thank you, Mayor. I do agree about competition. However, I am concerned about flooding the market, and not just with a number of ambulances, but all of our hospitals and different centers are going to have to negotiate whatever these contracts are. And if we're suddenly giving them, 6 different options, that this is a lot of added work for any of them. We've already heard staffing is a concern. So are we going to end up having our 6, how many are we looking at? 6 applicants competing with each other where staff is moving back and forth. I'm just, very concerned. I don't want to flood the market. We do need to increase this. We all were in agreement with that. And, we were looking for the best as quickly as possible, and the ones that as soon as we are able to have this meeting and pass or change our licensing, that they're ready to go as tomorrow or as soon as this is all possible. And I believe, we do have 2 that have this. I am interested in the hospital, the HCA hospital one for myself. The 2 that staff were recommending, I like that one. I like adding the Palms, the hospital system, just because it is specific to emergent care, and they're highest risk patients that otherwise they admit that they'll have to call 911 for if they don't have this. So for me, I like the 2 that staff recommended in adding the hospital. I mean, I know the rest of us, all the lights are on, I think, right now, but I don't want to flood it. We have 2 years. As you said, in that 2-year process, we're also going to rework the ordinance. There's a number of issues with the ordinance that we have to address, including the biggest one, I think, being negotiated response time. Because, we get these on-time reports that could be a patient sitting there for 4 or 6 hours, but if that's what was negotiated, it looks like it's on time. And that's not the intent of what we should be looking at. So when this ordinance comes back, we're going to be reworking a lot of this, and everyone who, even who do we have currently? AMR Medic. They're part of this opening up in the next time too. So, I like adding the 2 and with the HCA, that's my recommendation. I'm not ready to make a motion. I'd like to hear the rest of the board, but I am concerned about too much competition, not actually getting us the data that we need, because we need to know what we need. And there's, that if we're flooding it, I don't know. I'm very concerned about that.
Thank you. Commissioner Sachs.
I feel like this is some kind of a contest, but this is serious because we're not looking at small businesses, enterprises here. We're looking at serious health care transport. And when I look at the various applicants, I'm thinking, who would I put my parent or my child in? It's not necessarily somebody who is going to grow with us as soon as they're chosen. I want them ready today to transport. So this is the way I review this. Is a very serious decision. It's almost like picking a surgeon for a family member. And as I look at the various ones, it's very difficult to choose because we're looking at the next 16 to 18 months anyways. It's not easy for folks to understand that they're going to take over tomorrow and then have to go and do this again in a year and a half. And I'm sorry for that, but I guess that's just the way it is. With regard to taking care of the Western communities, we have a hospital out there. It's called Palms West. It's an HCA. So the Western communities are covered. And I'm a Western community too. Not quite as far west as some folks, but pretty far west. So we do have a hospital, an established hospital there, and so we're going to have a good transport to those communities. In fact, I think this county is pretty well covered with hospitals all over the place. So I think that we're pretty well covered with good transport systems, Commissioner. And then, secondly, with just looking at them, with eCare, I like the fact that they pay their employees more than other transport services, because I think it's important. You pay your employees well, they will, first of all, they must be very experienced to get into that pay scale, and they're going to stay, and I like that idea. And with MCT, you've got a depth that is important for emergencies. We need that. We are a big county, 1.5 million. We have a lot of people here. We have it scattered all over us. I think we're the first or second largest geographic county in the state. So we need that depth of service, which MCT provides. NHT, you were chosen by the administration and by the council, so that says a lot. And HCA, even though I'm pretty upset about Baker Act, I know that y'all are going to work on it, right, Doctor? Glad to hear that. And I did speak with Ms. Turnbull yesterday. She and I go back a long, long time, and I think that maybe we can work something out with that. And I like your specialty care because you have to. You're a hospital ambulance. You really have to. And Elite Medical, I think, is just excellent as well. So I know that I'm going to make my decision as I hear the rest of my colleagues, because this is what we do up here. We listen to each other and we make these decisions based on what we all think, because we all represent the entire county. So thank you, Madam Mayor.
Thank you. Commissioner Powell.
Thank you, Madam Mayor. I'll say that there's a reason that we're here. And that reason is because the current providers are not providing the level of service that would be sufficient for Palm Beach County. I do want to thank staff for going through this meticulously and coming up with 2 providers. And I don't think it's ironic that the EMS Council included the 2 providers that you all also selected. This is not an easy process. To echo Senator Commissioner Sachs, this is people's lives. As someone who knows all too well about making sure that your loved one is taken care of in a timely manner, I know how important this is to those of us outside of this room. It is necessary that, as Vice Mayor mentioned, that the area of the Glades is not neglected, whoever's selected. I also am concerned with what Commissioner Woodward said in terms of flooding the market. The previous Elite Medical indicated in their comments that when they previously operated, that they had 80 trucks on Fridays, which is a huge increase as opposed to what I heard is happening now. With regard to moving forward, this is extremely, we've heard from everybody, and I do believe that there were specifications that were put in place, and there's a reason that those things were put in place. And, I want to thank everybody who applied, but unfortunately, we're talking about people's lives. And especially right now, we're talking about from a period of February 11th through June 30th. Not to withstand the motion that our Vice Mayor already made, I think I want to do a substitute motion based on what I heard Commissioner Woodward say. And my substitute motion would, do I have to wait till she gets a second?
We didn't get a second yet, so.
Okay. So then I'll make a first motion and with hopes of a second, to approve the following secondary providers of emergency medical service. And that would be basically the recommendation of the EMS Council. We would include MCT Express, National Health Transport, Elite Medical, and HCA Florida Palms West. And that would be my motion based on what we're seeing today. Now, for those two companies that are not included, it doesn't mean that this is it. We've got a time period until 2027 to see if this works, if we need more providers, if we could swap them out. And as we've indicated, even in that case, we could stop in the middle and just redo it all again. So that would be my motion.
So we have a motion and a second, and we're going to have more discussion. Okay. You know who the second was? Okay, thank you. Okay, Commissioner Weiss.
Thank you. First off, I also want to thank everybody. I want to thank our staff, and I think it's really important, and I understand my colleagues' questioning of your bona fides, but I think it's also just understanding that you're looking at this, and we had a conversation before this meeting, that you're looking at this with the set of I's that you have and making sure the I's are dotted, the T's are crossed, and that you're staking your best sense of whether or not these companies can comply with the requirements of this. So certainly no way of discounting what you said. I also found it interesting that EMS Council also supported your choices as well. To the HCA folks, I think what you're offering is a different type of service, and I'm comfortable granting that COPCN for that level of service that you all are looking to do for your patients that are in your facility. And again, I encourage staff to, let's take another look at this. I would be happy to help when we do that. But that we need to have a different, for this kind of interfacility, maybe a different way of looking at what they're required to do. Folks at Rapid Response, thank you. You presented your company very well, and I encourage you to, if it doesn't happen today, that you come back and like to see you come back. And then our folks at eCare as well. I think you all put forth a very compelling case, but I agree with some of my colleagues here. I don't want to flood the market as well as we're making this change, and it's realistically we're another 18 months out, and we'll be going through this again. So those are my comments, and I seconded my colleague's motion, and so that's what I'll be supporting unless something else comes up.
Thank you. I've been extremely quiet, and this is very personal. And 3.5 years ago, when this came up, I was on the losing side of adding more than just AMR medics. And so I'm really glad that, per direction from us 3 years ago, from those of us on the losing side, we're having this conversation. I do have concerns about what is the right amount, being that we're revisiting this again in 18 months. We have 18 months worth of data to collect. And what we collect in that time frame needs to be accurate. We need all of our hospitals giving us information. We need all of our facilities giving us information, because we didn't get the information we needed for us to be where we are right now. And if it weren't for some personal experiences, I'm not sure we'd be here right now. So whether we take 2 or 4 or 6, we're a board of 7 that'll decide that. We do need to add. One way or another, we do need to add. What that right number is going to be, if we take all 6, it shakes out in 18 months because somebody's probably going to say there's not enough for us. And do we ask them to make that investment now and then in 18 months that investment is a waste because they haven't had enough? So I would tend to go with the 4 providers that the EMS Council approved for us, and I know we have our EMS Council representative here. No one asked you why the EMS Council expanded on what the county staff did, so would you like to do that, Chief Ippolito?
So the EMS Council, we focused on 2 things. First and foremost, compliance with the ordinance, and second of all, with the companies that had the capacity and the expertise to fill the immediate need for Palm Beach County. So that was our focus, and the 4 companies that are with you today are the result of that.
Okay. So I would actually be in support of the motion that is on the table right now. And I do have some more lights on, so Commissioner Flores.
Yeah, I guess, as I'm going through this, if we're going to approve 4, I feel like we're going to leave one company that is home-based here, a constituent of the county, and they're the ones that is going to be left behind. The one company that's Rapid failed to fill a component of the application process, so I'm okay with leaving them out. But I feel like eCare, it's a small company, it's a local business, someone who is already providing the services in another county, so they, we got to assume that they know exactly what they're doing. They have leadership that has been doing this for a long time. But yeah, we're going to leave the home team out, and I feel bad about that. HCA is a hospital. They're only going to have 3 ambulances that they're proposing. They're not going to be providing high volume transportation in the county. So I guess what I'm asking this council, if we're going to make this decision, why don't we add a local team to the mix and let them compete? Because like you said, in 18 months, we're going to revisit this anyhow. And if we're just going to leave them out, I feel, we should be protecting our own. We should be fighting for the Palm Beach County business. And that's what I'm here to do. I'm advocating right now for eCare.
Are you making a substitute motion? Commissioner, are you making a substitute motion?
Yes, I'd like to make a substitute motion to include the 4 that were mentioned before and eCare.
Second.
Okay. So we have a substitute motion from Commissioner Flores, a second by the Vice Mayor and Commissioner Sachs in unison. And Commissioner Baxter, your light is on. And then Commissioner Woodward.
He covered a couple things. I was going to say, HCA isn't a full-on provider. When I came here today, I fully wanted to, I had always said all along I supported an additional 3 to 5. It wasn't until I looked at slide 22 and I realized that it was Rapid Response Medical Transport, and hearing her that she's already serving Hendry County, which is Clewiston, which is right next to my Glades region, which is the western communities, which 2 of my commissioners spoke up about concerns. So I thought she'd be probably best situated to serve them. So that's what made me go to 6. But I've always said the 3 to 5 was kind of my threshold on adding. So if clearly my board has spoken and they are saying we don't want that, then okay. But I do, eCare is the people here, the business is specifically in my district, and I want to support home team. I want to support people, and I want to support competition ultimately. So that's why I seconded Commissioner Flores's motion, because I do believe, why would we leave the one company that is the home team here already? And as far as the infrastructure concerns and asking them, most of these most of the companies here already have set structures in place in other counties. So I doubt that even in 18 months, 2 years, whatever that shakes out to be, that it would be a huge hardship for them to pull them back into other areas. It's not like they're starting up from nothing. I do value the cost of spending time investing in Palm Beach County. So I do thank them for that and taking an interest in us. But we do need more data and to see who in that time period shakes out to be the best. So thank you.
Commissioner Woodward. And then Commissioner Powell.
Thank you, Mayor. If I could, with staff, or maybe Chief could answer, I'd like to step back just a little bit on the process of how this works for the facilities who will be using these COPCN providers. So when they need a vehicle, could walk us through the process and what it is right now, and if we add 6 of these or however many it is, what would the process be when they want to call for an ambulance?
So right now, if they need a transport, they call AMR and medics. If you add another provider, which obviously this board is going to decide today, they would then enter into a contract with that provider and the provider would respond accordingly. They would have to meet the ordinance requirements as far as response time goes. I mentioned earlier that the hospital or the assisted living facility does not have to enter into an agreement with this new provider. However, if the provider is by chance called for whatever reason, they still have to respond because it's just part of the ordinance. They have to respond countywide, and it's part of their application as well. So I wanted to clarify that because our attorney was chiming in my ear earlier. And then they would have to meet, whether depending on the type of call, whether it's 6.1, which is a priority 1, 6.2, which is urgent, or 6.3 pre-scheduled, they would have to respond accordingly within those time thresholds. Now, as you mentioned earlier, the pre-scheduled is agreed upon time. So the ones that we're falling short on is the 6.1 and 6.2. So that's where the critical nature. So
if I could just, the question is, if they call, they already know what they're calling for, say they need to call for 6.2. They put the call in. Right now it goes to AMR and AMR tells them what's happening. Yes. If we provide, because the healthcare, or the Palms West would be similar to the healthcare district, it's not part of this overall list of ones to call. We would have 4, if the current motion on the floor stands, it's 4 different possibilities. How would that work if you are a provider and you have 4 options?
It's news. I don't know how a hospital will prioritize on which company they're going to call. They will probably likely call the company that responds the best.
And how
it's going to work.
How long do you,
are.
just out of curiosity, because I keep thinking about the patients that are sitting there, and how long will it take our facilities to, a few months to kind of shake out who's the top of the line? So we're going to have patients sitting out there for the next several months while facilities figure out with 4 different providers who rises to the top. And then are we going to have the ones that rise to the top, be able to kind of cherry pick which facilities that, and because those facilities are going to call them. And then we have some of our other facilities that maybe aren't as, what's the word? They're more difficult to service, let's just say that. And then we end up with service provider, or some of these AMRs or whoever it ends up being, they go to the other place because these ones are going to the top. I'm just worried about, I don't want to use the word equity in this, but how do we make sure if we have 4 different ones with several months of hospitals or facilities or nursing facilities calling through to the 4, and then there's going to be some that rise to the top, some that fall to the bottom, and then the ones that fall to the bottom, are those the ones that pick up the least desirable patients?
Yeah, and I'm not here to answer for any of the hospitals or assisted living facilities that are going to be entering into these contracts, but I do know prior to those negotiations being worked out, if any new provider is added, that there is an agreement already with AMR and medics. So there's not going to be a gap, but once those contracts are in place, then yes, it would be up to the hospital business decision on who they're going to call. I mean, we have a hospital here, maybe they can answer. It's new to our county, so.
If we have, please.
Please.
Yes.
Yeah, I mean, that's the good news, bad news part of this is you are going to have options. And as a hospital, it's going to come down to quality, reliability, accuracy, transparency of data. When they show up, do they have creases in their shirts? Are they going to, because the patients can't determine when our care ends and a transport provider begins. And so now we're going to have options. And it's going to be one of those, and I'll just tell you, I'm responsible for my hospital. It's going to come down to quality, reliability, care experience. At the end of the day, is going to win. There's going to be a competitive season that takes place associated with this, and price point is not even in the conversation. It's patient-centered care takes the lead in the conversation. It's going to be competitive. It's going to be worth watching.
It's going to be competitive for the high volume areas. What about our lower volume?
You're absolutely, when I'm hearing you, present this scenario out loud, I'm thinking about our hospital. We are, like I said before, the safety net hospital to Belglade. We are likely going to be the ones that would step up to take care of those patients. We're receiving them now, but we can't do it alone. Healthcare district can't meet the need right now on their own. It's too far. The time on task associated with the transports are too high. I love what I'm hearing over here by the commissioners about there needs to be some level of focus around caring for those that don't have the greater payer mix or are more difficult to get to. That's why I'm standing here at this podium. For one, meet our needs, but I also know we take in 1,900 transfers a year from an area that's not going to be financially as desirable. And we've stood up and have served as that backstop because it's the right thing to do. That's what we do, mission driven. And we're going to find a provider that supports those other 85% to do the very same thing. It's going to be competitive, and it's going to be right by the patient.
So how many trucks, if the current motion passes, how many trucks are we adding? I was counting.
Math in my, do you want to pull that slide up, Lee? It is slide, do the recap slide.
I think that was that page 18 or slide 18, I think?
80, not including HCA, I believe.
25 plus. 200? No. Only these, what the dedicated to Palm Beach County. 3. You want the 4 or the 5? 4? Which 4?
The current motion is.
The current motion is everyone but
It's 5, right?
I believe it's 80.
Plus.
Yeah, it's A, B, and C.
Yeah.
If we take the highest number, it would be 83.
80
And how many?
3 with HCA. Yes.
And how many trucks do we currently have?
Right now, 61 are registered with AMR and Medics. 61 or 60, it's around 60. Total right now are the trucks that are registered with AMR and Medics is 61. And then Healthcare District, Lee, do you have the number of trucks that are registered with Healthcare District? I think it's 3 or 4. So, and then so we would be adding an additional.
Is that HCA too?
That's
so to add 4. The motion was 58. The motion that's on the floor, which is 5 companies, is 73. An additional 73 trucks.
An additional.
Based on what they presented in their application.
So we're, with this motion, we'd be more than doubling what is available right now, not including 911.
Assuming it's all staffed.
Correct.
Yes. What if we are adding Elite Medical? Are they still in the house? I would like to ask a question for Elite. Are they?
Oh, that's E-Care. Sorry, Elite E-Care.
And E-Care will be next.
Yes.
Yes, Elite. So in here we have. Is it on this slide? Right now, you have 44 trucks. You're looking to dedicate 30 to Palm Beach County, and you currently service 8 other counties.
Slide is old.
Okay, so what's the current numbers?
Current numbers are 44 plus 23, 65 trucks.
You have 65 trucks, and how many are you dedicating to Palm Beach?
Well, up to 30.
Up to 30. And you service 8 other counties. Are you pulling any trucks from those other counties?
No trucks, no staff.
Okay.
We already have 55 hired, and we have 83 in the pipeline from Palm Beach County.
Okay. And if E-Care could come up, I have the same question for you.
And just to clarify on our math real quick, 58 at the original motion, 83 on
It's
the
83,
current
right?
motion. Yeah,
It is
sorry about
83. Okay. Yes, eCare, how many trucks do you have right now? Are these numbers right?
We have 25 that we're gonna dedicate to Palm Beach County.
And how many trucks do you have for Monroe?
Right now, we're operating in Monroe. We have a total of 5 trucks in Monroe.
Is that the
We
only-
have also in Citrus as well.
I'm sorry?
In Citrus as well.
Citrus, how many do you have in Citrus?
We have 5 of them in Citrus.
Okay, thank you, sirs. I appreciate that. I still am very concerned about adding 83 additional trucks to the 61 that we have. So I know that there's a motion on the floor. I won't be supporting it.
Thank you.
Sorry, I'm sorry. Mayor,
Right.
I have one further point I just wanted to make, that I do understand and very much want to support our local businesses, and I want to support small businesses. This is a little, this is one of those times that it's very important that we get this right, because this is about people's lives. And I mean, for me on this board, this is my first time dealing with it, but the mayor, had a very personal instance with this with her own, family member when she brought this to us, and it really does bring it home. And now understanding what it means when someone goes into a hospital, you can't take them out of that hospital to take them to another place if they're having a stroke, unless you want to discharge them. So we have to get this right. And this is not, for me, about helping small businesses or helping local. I want the best. Whoever the best is, that's who I want. And we have 18 months, I know, to get the data right. But I don't think this is the time for us to focus on where the companies are, or, how we can help them. This is about helping people who are having a really, really bad health crisis, or are their family members, and how we get this right. So I just think we need to remember that. Thank you.
Commissioner Powell.
Madam Mayor, I'm willing to work with my colleagues to do what is best for the people of Palm Beach County. I can take Commissioner Flores's point very well in terms of looking out for local. I will admit that there are other companies here that do have home bases here in Palm Beach County, and I also can take into account Commissioner Woodward's comments with regard to the importance of making sure we get it right. And I'm mindful that we do have 18 months. So with that being said, I'm workable. Whatever the board feels is in the best interest of the people of Palm Beach County, I'm ready to support.
Thank you. Commissioner Sachs.
Well, I think we all agree that it's something very serious. I researched a little bit the other counties. Broward County has over 1 million residents like we do, and they have 6 providers. I think 5 or 6. They told me 5. I better check my Broward County folks, but that's okay. The bottom line is this. If I need an ambulance, I want an ambulance that's going to take care of me or my family member. It's got to be the best. And I don't see any reason why, have not heard any reason why we cannot have competition of having 5 of the best applicants that I've ever seen before. So I am seconding the motion that's on the floor for 5. I think that unless somebody tells me otherwise, and I'm looking at my experts here, having so many ambulances is a good thing. We're a large county. I want it covered. I want the best. And I want those that have completed the requirements that we ask them. It's the very basic requirements. Those are the ones that I will consider. Those are the ones that were here today. And that is eCare, MCT, NHT, HCA, and Elite Medical. And then let's see, that's why I'm seconding the motion. Let's see what happens in 18 months. And maybe we'll have these same 5. I'd like to see specialties, evolve, but that's down the road, or even geographic locations, but that's down the road. But I think the reason I'm seconding this motion is because I want the very best. Thank you for the work you did.
Thank you. Commissioner Flores.
So I have a couple of points. The first one is regarding how the hospitals handle the call volume and which ones they're going to pick. I mean, I think that's part of providing great customer service. I think the best ones are probably going to get called first. I think that's good for competition in the upper market. And one of the things that I learned early on, all of these players play in other counties together already, so they know how the system usually works. And that's something that I found very interesting. They all know each other from Miami, Broward, Monroe, whichever county you can think of. So I think that's really up to the hospitals for them to figure out which partners they want to go enter into contracts. Regarding the volume of trucks, we're saying 83 max or total. Additional, correct. So if we pick 4, it's going to reduce by 20. My point is, we're not going to have 83 ambulance starting on day 1. It's going to be a gradual ramp up for all of them because they have to field the workforce, and that's going to be part of it. I don't think they're going to be able to get to 83, and that's what they're coming here for. I know that some of them have already made commitments for ambulances or whatever, but at the end of the day, it's going to be supply and demand. If they're not getting calls, they're not going to field more ambulances. So I think that number is probably going to be a lot lower than we're really assuming. And then the other part is nothing on here, when we're talking about picking the best, not one time did we get customer service reviews, actual data. What we're seeing is, basically trips. That's not a measurement of saying that somebody is better than another one because the number of trips or because they provide more services somewhere. I think we have to be objective on how we look at this. On here, it could be interpreted many different ways based on the numbers, because really that's what we're looking at here is just numbers. It doesn't mean that a small business can't be the best at providing customer service. That's what I wanted to bring up.
Thank you. Vice Mayor Baxter.
Just to clarify with the clerk, we have a first of Commissioner Flores and a second, which was myself and Commissioner Sachs. So is that where it stands? That's the only motion on the floor?
Yes, I have currently Flores and Baxter currently, and Sachs seconds as well.
Okay, perfect. I still support it. I did want to comment on a few things. Just because a business is small doesn't mean that service is not as good. Just because a business doesn't have as many vehicles doesn't mean, I don't know why. Yes, it does come down to the people. It comes down to the service. It comes down to the quality of care. But just because there's a lot of trucks and people doesn't necessarily make that the best. To Commissioner Flores' point, we're talking about the only difference right now in the two motions has been whether we have or don't have e-care, I believe which is C. And again, 20 trucks isn't, I think, the end all. And to Commissioner Flores' point, it's just a matter of they're going to have staffing issues and they're going to have to deal with bringing trucks here and more people. But I don't think that one company is going to make or break this in an overall picture. I don't want to exclude the local guys. I don't want to exclude the people that are also here. And every company we've met with has praised, their ability to do the best. I want them to prove it. And so that's kind of where I stand. I would like to ask the mayor, maybe after Commissioner Weiss's comments, if we could at least do a roll call here and see where this stands before we move on.
Commissioner Weiss.
Thank you, Mayor. Chief, I just want to ask you a question in regards to the EMS Council, because I was looking at what their recommendation was. And to the extent, and I know you can't pick what's in everybody's head, can you do you have any explanation why eCare only got one positive response when you all met with them?
I couldn't speak on behalf of the entire board on that. Again, our direction and where we focused on was, again, compliance and also the capacity and experience. And to the commission's point, the data is very limited on measuring what experience is. So for me personally, and my vote, it was their experience in providing care to multiple counties at one time, and using that as a point to say, okay, that might predict success in Palm Beach County and the size. And again, that's my personal opinion. I can't speak on them.
And that's all I can ask you for, so I really appreciate you sharing that with me. I mean, my inclination was to go with the EMS Council's recommendation because I rely on people who have, I think, more experience and direct knowledge of these matters in this kind of when you're looking at a specialty like this. But if you know, the idea of adding another 20 trucks, I mean, I do have concerns that we could flood this, and that nobody. My concern is that if we get too many vehicles out there and they're not producing the revenue that the businesses need, they're going to take those trucks away, and will put us in a deficit if too many, if it's too much. That's my concern. But if you all want to make that determination and say, you know, let the market have it, I can go along with it. But I think it's because I know it will only last 18 months. But if I hear, I would ask staff, I mean, if we can get some interim reporting. And this is really where we need our hospitals, and we know they didn't tell us what was going on last time, which is why we're here today. They wouldn't share because of their concerns of whatever
Not getting service.
not being serviced. That can't continue, and we've got to get that. But if that were to come up, I would say we would then look to suspend, you know, licenses if we can't make this work, or if it's not working. So those are my comments.
Administrator Baker?
I'm just going to speak to the hospitals because they are primarily private. We got one public hospital. And we did meet with them after our last meeting because the board directed us to try to require or request information from them. They did not respond. We have no authority over them. I want to be clear about that. And so if this is something, I would strongly recommend that if the board is going to move forward with 4 or 5, however many, then maybe we put that responsibility back to the servicers, the companies that are going to provide the service, to provide us with that certified data so that we will have that information. They're the only ones that I think we could write into the contract that they provide that information. But we can't require the hospitals, and they tend not to want to give up that type of information. And I just want to make sure that we're not sitting here when you tell us to come back and we don't have that information for you. So if that is the type of information, even a survey, if you want to find out whether people were happy with the service or quality of it, that's again going to be where we have the most control, and that's with the people we're contracting with. Just a point.
Thank you. I actually think it's a moot point. The hospitals didn't want to answer because they were afraid that their response times would go down. And, pardon me, Berdina, but we as a board, if we're trying to get as much information as possible. The hospitals don't have a barrier now. If they choose to not answer the questions, that tells us something. But, my concern about adding 85 or 83 trucks at this point is who's going to staff it? Where is that staffing coming from? Are you taking people from other agencies, other, companies? If you all can sit here and tell me you have all those trucks staffed immediately, then, we go forth and conquer. And hopefully you all succeed and you can all stay in business and you can all have enough business. That is my biggest concern, is that, everybody can sit here and promise, I'm going to deliver 30 trucks, I'm going to deliver 20 trucks, I'm going to do 10 trucks, I'm going to do 3 trucks. But you need to have the staff on those vehicles to service our residents and keep our residents safe and get them the best service they can possibly have. You have 18 months to do that. And if in that 18 months you do not do that, that's up to you all. It sounds like the consensus of the board, and I don't think we need a roll call. It does sound like the consensus of the board is to allow 5. I think rapid response, I look forward to you coming to us in the future with the audited financials, but that's not what I'm hearing from the board. So yes.
Are you preparing to take a vote on it?
I am.
Thank you.
Because I have no more lights on.
Perfect.
And I think we've beaten a dead horse. And hopefully we have 86 trucks to take that horse away, but.
Madam Mayor, if
Yes.
we can just help get you in the proper posture to take that vote, if that's your motion, by following the recommendations that we have, because there is an A, B, C, and D as well that needs to be in the formal motion, particularly on the D side of it. So if your motion is to include the 5 or the 4 that were recommended by EMS Council and the 2 staff, E-Care Ambulance, and deny rapid, then you can change our motion that we have to approve A, B, and C and deny D based on the application requirements and the non-recommendation of the EMS Council on rapid response.
Commissioner Flores?
All right, so I'll make the motion to approve A, B, and C, and deny D.
Second.
Hold on.
So you just have to have a finding with D. And so you can read what D says. The reason for denial.
The reason for denial would be that they did not give us the audited financials.
Did not meet the EMS ordinance application
To meet the ordinance.
requirements.
So you want me to make the motion again? All right, so I make the motion to approve A, B, and C, and deny the following secondary provider EMS COPCN for the period of February 11, 2025 through June 30th, 2027, that did not meet the EMS ordinance application requirements. Is that enough, or do I keep reading?
You want to read the company name?
Okay, was not recommended by the EMS Advisory Council and did not meet the needs for the proposed services.
Rapid response.
For rapid response.
Keep going? Okay. Rapid Response Medical Transportation LLC, doing business as Rapid Response Ambulance, doing business as Rapid Response EMS, service areas of all Palm Beach County.
Excellent.
Okay.
Second.
We have a motion and a second. Commissioner Sachs, we're going to take a vote. Would you like to join us? Because I know how important this all is to all of us. We have a motion and a second. All those in favor, please say aye. Aye. Are there any opposed?
Oppose?
See that the motion carries 6-1. But here is your caveat, no clapping. Here is your caveat. You have 18 months to prove yourselves, but it is not at the expense of our residents. Okay? It is not, and that's Commissioner Woodward's main concern, is that if you don't succeed, it is going to be at the expense of our residents. Please do not make that happen, because we do have the ability to revoke your license, correct? Commissioner Powell.
We're done with that item, correct?
We're done.
Wonderful. Madam Mayor, I would like to make a recommendation that we have add-on 5H1. I'd like to recommend that we postpone that item until the next board meeting.
Second.
Y'all all right with me?
Okay. All right. We actually do, I know, we'll give everybody, you can all leave. Bye. Thank you for being here. We do actually have a little bit of business left to do. And our clerk, Clerk Abruzzo, did you leave or are you still here? Okay.
Me too.
We'll bring Clerk Abruzzo back because I know he wanted to share some information with us. I know we have other staff comments and board comments and, okay.
I'm waiting.
Oh, okay. We're going to take 10 minutes to go because I have some people who, nope. You know what? How about we give Clerk Abruzzo 5 minutes? I said, go, you need to go, go. I'm going to go. All right.
Okay.
Clerk Abruzzo, thank you for joining us.
Thank you. Thank you, Madam Mayor. I appreciate the leniency. It's great to be here amongst you. And if I may start by saying congratulations to Commissioner Flores and Senator/Commissioner Bobby Powell. I apologize I was not here for your swearing in. I generally become mayor for about 10 seconds, but with your indulgence, I was on my honeymoon. So hope I have an excused absence from that, Madam Mayor. I wanted to start off by saying, as the official treasurer and CFO of the county, I want to commend yourselves.
One second. Can you all take your conversations outside so we can hear? I appreciate that. Thank you.
Thank you, Madam Mayor. I wanted to start off by saying, as your CFO and treasurer of the county, I often go out throughout our community. I was just in Commissioner Woodward's district last week and give presentations about our financial state. And one of the slides in my presentation, after we go through the national debt and the trouble the nation is in, I show the county and our debt and how incredibly well managed our budget has been for decades, and commend all of you for keeping up with that. We actually, if decided by you all, there's a path to be, and I wouldn't necessarily recommend this, but you could be completely debt-free by 2044, which is remarkable. You can look at any large city, municipality, county in the entire country and really not get to a place where if you truly wanted to be debt-free, you could. It really is remarkable, both staff and commissioners for decades, and you're continuing that process between our bonds ratings and where we stand as a county is truly top-notch. So thank you, commissioners. I wanted to let you know that. I come here with good news. Last year when I reported to you the record-breaking $173 million in investment earned income, up from $27 million annually from when I first took office. I'm reporting you today our audited financials from our fiscal year came back about a month ago. We have earned exactly $230 million in extra investment income for the county. What that means is you will have more money for your general revenue. And I know there has been some discussions I've had with some of you all up here today about what that means as far as general revenue versus some other funds. I'm here for any questions you may have, but wanted to deliver that good news in person. And it's my pleasure to continue to be your CFO of the county. That said, I will actually say this on one note. Our goal and what we are striving for internally at the comptroller side of our office is that in the 8 years now of, what will be 8 years by the time this term ends for myself, that I return over $1 billion in investment income, which has never been done before for any large county in that amount of time, even our larger counties, sister counties in Miami-Dade and Broward. So I look forward to hopefully hitting those marks. As you know, we manage all the money internally. We do not farm this out. There's nobody doing it for us. As we speak, there's financial professionals on the second floor moving our money around, making sure that this income continues to happen. And we do see, I can almost tell a year out of what we're going to hit, and I believe we will hit these numbers again next year.
Thank you. And that's really good news. My only caveat about that is there's going to be some point in time where this is going to level out. And so from a budgeting perspective, Administrator, from a budgeting perspective, I know that a lot of this goes to our reserves, as it should, especially since we just took 20 million out of our reserves. A lot of this does go to our reserves, and I'd like to see that if we, because of this, having the ability to give back to our residents by cutting the millage rate, so be it. But I don't want to see us taking this money and putting it into ad valorem funded programs and positions when in fact in the future it might not be there. So this is, to us, this is found money. Doesn't mean we have to spend it, but it could mean that we can give it back to our residents. So I've got, wow, everybody's lights are on. I wasn't even paying attention, but I do know that Commissioner Flores had his light on. Go ahead.
I just want to commend Clerk Abruzzo on the work and the leadership that you provided the county for quite a while now. I know that you've had 2 record-breaking years back to back. At the end of the day, we want to say thank you. At the end of the day, it's about making sure that the money's safe, and I know that in your hands is that it's safe. So thank you so much for doing that. If we can repeat it another year, so be it. But I know, very similar to Mayor Marino's comments, at some point the market is going to level out. I know that these are peak years, but I just want to say thank you for your leadership.
Thank you, Commissioner. Madam Mayor, if I may respond.
Sure.
And first off, I have to commend Commissioner Weiss, who chairs our Investment Policy Committee. We have a strategy where when we see, by the way, the Fed chair just announced today they do not see rolling back interest rates in the near future, which is, we can, that's welcoming news for our investment strategy. But when we see the rates starting to change, we're going to lock in for longer durations. So I would submit to you over the next 4 years of this tenure, we likely are going to hit extremely high marks no matter what, because we will be able to lock in. And that's key. So I look until the next presidential election, we're going to be, hopefully I'll be able to report these incredible returns to you all.
Much appreciated. Commissioner Weiss.
Yeah, I wanted to thank Clerk and Comptroller. You guys, you and your staff have done an amazing job, Joe, really have. But also to second what my colleagues are saying, I mean, this has been our benefit because of the higher interest rates. And, hopefully at some point, as on the other side, we want folks to be able to have lower mortgages and that sort of thing. But when that happens, then of course our returns in the market are going to be lower. But the fact that you all have a strategy to lock us in is once we see the Fed make those moves, that will protect us at least for a while. But to have the opportunity to earn this kind of income is a testament to your efforts and the efforts of your staff. So thanks, Joe.
Thank you, Commissioner.
Thank you. Vice Mayor Baxter.
Thank you, Mayor. And I want to also thank the clerk for being here. And thank you for the amazing job of helping our community by bringing back $230 million. That's not chump change, as they say. That's a lot of money and a huge increase from what we used to. I would like your expertise on the ability of how long you think this would be sustainable.
I see it sustainable, Madam Mayor.
Mm-hmm.
Please.
I see it sustainable at least throughout this term, where we will be hitting between that 170 to well over 200 million. Like I said, we are able to lock up. As you are well aware, because of your leniency, we are the world's largest investor in Israel bonds. That alone is making us a significant return. So that's when I took office, to add some context, we were earning $27 million a year annually. The Israeli bond portion, which is 15% of our portfolio, is earning us approximately $35 million a year. So 15% is outperforming what 100%. And the other counties, large counties, haven't hit anywhere close to us. And I just want to be clear because it's a testament to, I think, our entire collective vision on the comptroller side. When I took office, I allowed things to divest and made sure that we were, I believed from my comments at the time, I know some of you weren't on the board, that we were going to hit inflation. A lot of people didn't see it coming. The White House actually tweeted against that it was going to happen at the time. I wanted us to stay flexible where we can jump in and lock into the higher rates, which is, it's bittersweet. I do not want to see inflation rise for the country, but it happened. And we were able to move our money quickly and get into a position where we can take advantage of these incredible rates for our taxpayers here in Palm Beach County. I do believe, as I stated, not to be repetitive, we will see this coming for quite some time because we are able to lock in billions of dollars of our funds to make sure we have this type of revenue and income.
And I appreciate that and your ability to lock it in. I would like to request from the administrator so that not just any one person is making the decision on these, let's say, extra funds of $230 million. If we could get a presentation on how this board, and let the board decide how we would like to spend that $230 million or not spend that $230 million, and where we would like to see it go. Specifically those dollars.
I'm happy to bring that presentation before the board so we can paint the entire picture. And since I have the mic, I'd like to thank the clerk and his awesome staff for the investment. We're able to project the interest, and he definitely brought in more than we projected. So we're happy to bring that presentation back to the board.
In addition, we have strategic priorities within the county, and maybe just identify some capital projects or some things, or some infrastructure, some things that it could also potentially help with as well.
We will bring that back to you. And again, I'd like to thank the clerk for that, but you will not have $233 million to allocate. So we'll lay all of that out and paint that big picture for you.
Why wouldn't we have?
Because we budgeted for some of that already, and it's a part of our overall budget. So we're very grateful that the clerk did such an outstanding job for us, because then we've covered our budget plus had additional funding. So there will be additional funding, and so we'll bring all of that back to the board.
Curious, approximately how much has been budgeted for out of the $230 million?
We would need to go fund by fund. I think we had this discussion before, but for the general fund, the interest generated that stays within the general fund, we're estimating we have about $500,000 that will be extra in the general fund. But the other funds, our capital funds, are, yes.
So you've already budgeted the entire $230 million?
No, we have not budgeted the entire $233 million. He earned more than we projected and put into the budget. But a portion of that $233 million we have already accounted for.
What was the projected amount?
Sherry Brown, OFMB Director. So last June, when we started talking about the 25 budget, at that time, we estimated we would collect about $195 million throughout all funds. But a big chunk of that is in the general fund. And we're coming to you in March to true up our estimates for their balance brought forward. And in the general fund, whatever our estimates back then, we're only about $500,000 off. And I don't know the difference between all, but all the other funds, the interest earning stays in the funds where they were generated.
What was the projected amount for interest earned?
Overall, it was $195 million.
Okay, so.
But within the general fund, we estimated that we were going to earn about $31 million, and I think it came in at 31.5. So we were only $500,000 off in our estimates.
So you must have as much faith in the clerk as I do. So you thought he was going to bring in 195 million?
Yeah, that's what we presented to the board back in June.
All right, well, thank you.
So, I mean, when we start to prepare the 26 budget, we're going to have the last 2 years of actual collections to look at and that type of thing. But, you know, in fiscal year 22, interest rates were pretty low. Our budget was about $3 million and actual collections in the general fund was $5 million. And then you've really seen interest earnings rising in the last few years, and that's where we're seeing more. But we do look at this on a regular basis, and we include it as part of our estimates when we build the next budget.
So what you're saying is you've included this in estimates, but it actually hasn't been allocated yet because we haven't done the budget yet.
It was. Your estimates for 2024 is what is your balance brought forward into 2025. So you've already budgeted those estimates as part of our 25 budget. And then when we bring you our mid-year cleanup in March, we're taking what we estimated to what actually happened and cleaning up the funds then.
Well, I look forward to the presentation.
Great, thank you.
And just for the record, the clerk staff, as I said, they're outstanding. They do work with us throughout the process. So we receive input from them as we're developing our budget.
And we'll start asking for 26, what do you think we should budget for the 26 budget for new interest earnings in the next fiscal year? And we work with the clerk staff for that.
I think what the consensus is that the new interest earned, we know is not going to be sustainable after a certain time frame. So it can't, you know, if you're putting it in capital improvement, because that's, you know, that fluctuates. If you're putting it in capital improvement, in our capital improvement budget, that is a benefit to us. But if you're putting it into hiring, you know, 12 people, and then in years coming, we don't have that. Now those 12 people aren't funded. So what I meant by, and I think what the vice mayor is getting at, is these funds, regardless of whether you know that they're coming or not, have to be in positions where if the funds are not available in the future, we're not hurting the services that we provide.
Correct. And keep in mind that even though it's $230 million, we have a $9 billion budget. So interest earnings is about 2% of our total revenues. So it is big, but it's not our largest. You know, property taxes is really our biggest collections.
Madam Mayor?
Yes.
The money that we control, that we invest, we're earning over 5%. Just, I want to make that
Right.
clear, not 2%. What occurs now, like I'm going to take 2023 and 2024, from what was budgeted to what was earned in your general revenue part was over $35 million of extra revenue that wasn't accounted for in the budgeting. That gets rolled into reserves and then gets, for lack of a better term, and you could speak to it better than I can, I have my staff here, it gets kicked down the road for almost 2 budget cycles and then re-upped. What I'm asked Administrator Baker earlier today, we're going to have a meeting with our staff to go through exactly the way that funds are allocated, as well as you're hearing that a large part of that $230 million is not put into your general revenue bucket, but there are hundreds, if not over 1,000 different line items of capital projects, special reserve funds. Each one of those are handled differently. So we're going to go through it to give you a better presentation on what you can actually do with the funds. For instance, there could be situations where, let's say you allocate $1 million to a special revenue fund or a capital project fund. Remember, general revenue in means you could take general revenue out. You could actually hold more of that money in your general revenue fund rather than allocate it, because you know that we just earn that extra income for those funds. Those are decisions you will all have to make. But I want to get that laid out for you, your actual tools in your tool belt for finances of what you can use. I think it's extremely important. There may be ways where you can use some of the funds, because I heard some of the commissioners offline, one-on-one conversations. that you can use them sooner rather than later than kicking the can down the road if needed. But I concur with you, Mayor, to a great degree. These are funds I believe you will always have to look at as in a single shot, never to budget out year after year after year, because you are correct. As although I'm reporting to you, the good times should roll for many years to come, there will come a day where that is not the case.
Thank you. Administrator Baker, your light is still on. Would you like to add anything? Okay. Commissioner Sacks, then Commissioner Woodward, then Vice Mayor Baxter.
I think we got the best clerk of all the counties, senator, clerk, comptroller. 5% we're making, huh? And you know, you do this at great personal risk to yourself. And I want to thank you of where you decided to place these funds out of respect for our greatest ally, and also to take care of our monies, because this is a hungry county. And yeah, I'm sure that it's going to do well for us in the future, and the best is yet to come, as they say. Thank you so much, Commissioner.
Commissioner Woodward.
Thank you, Mayor. First off, thank you, Clerk Abruzzo. Amazing numbers. And I do thank you for, we need to keep a sober mind on this, because, you know, while I do agree with you, I think that this will continue. But then again, there's things that happen in the world sometimes that none of us saw coming, 2020 being a good example. Which brings me to my question for the administrator on this. I would like to echo the not using this for operations, for capital projects. And I would like for us to know, like, what can we do with this money? And it's, you know, not just for our own benefit. I think the public should know if we're able to fund certain capital projects, or, you know, we see where this was paid for with the infrastructure surtax or whatever. I mean, if we're able to pay for certain capital projects, I think it would be beneficial for the county to know. And if we can, you know, lower the millage because of something like this, I think that this would be huge. And it's a good thing that you do, that we're earning interest on this, because we as a county are so large, and we're able to, you know, we have a lot of money into this that you can invest for us. But find a way for our people to also feel that, and us too. We're all taxpayers here as well. But I look forward to understanding how we can better. And I very much echo, I don't want this to become something that we expect in our budget, especially for anything with operations or anything that's recurring, because we don't know how long this will last. And again, the public ought to be made aware of this. And the things that we are able to pay for are, you know, we can pay for certain things that have been deferred, or if we can lower the burden on them, however this shakes out, this is a good thing, and I'd like to thank you.
Thank you. Vice Mayor Baxter.
I'm going to be honest, so much time went by, I forgot what I was going to say.
Okay. We're done here. If you think about it, let us know. Okay. Clerk, anything else you'd like?
I remembered.
Oh, okay.
When we have staff come back with a presentation on those dollars, if we could coordinate with the clerk for that information that you said you wanted to bring with us, I think that would be a great dual presentation, if you wouldn't mind.
Madam Mayor, thank you. Yes, I plan on working with Administrator Baker and her staff and our staff together. We will present it with your indulgence together. We're going to work very hard, make sure we lay out a full picture, especially that this money is going to be coming in for the foreseeable future. And I cannot thank you all, especially to reiterate Commissioner Weiss, who chairs the committee that sets the parameters of actually where we can invest the money and how we can move it around. But we're doing it all right here in this building, outperforming even the clerks that outsource it to the Wall Street firms. We're not paying high fees to earn this money, because it's all done in-house, and cannot thank you enough for the support, and we're going to keep it going. Thank you, Madam Mayor.
Thank you. All right, with that, we are on to staff comments. Administrator Baker. Oh, yes? No, staff comments. Sorry?
Mayor, may I be recognized? Sorry.
Yes, you may.
There was a vote that was on the floor to postpone item 5H1. The vote wasn't called. Can we have it called, please?
Yes, it was called and it was 7-0.
Okay.
Thank you. You are correct, Commissioner Flores. Sorry, I went to staff comments because of the clerk. Commissioner Flores, board appointments, please.
Appointing Claudia Mendoza to Zoning Commission.
Do you have any board appointments? Commissioner Sachs, do you have any board appointments at this time? Commissioner Weiss? Vice Mayor?
Nope.
I do not either. Okay, so now we will go to staff comments.
I only have one, and that is to thank, and I should have done it while they were here, to thank Stephanie Shanahaw and her staff, along with our EMS council representative, along with the county attorney's office. It was an arduous process. It always is. It's painful every time we go through it, but we come out with good results. So I would like to recognize them and thank them for the hard work that went into it. And it's a team approach. What one doesn't know, others surrounding them should know. And so I just want to thank them and thank you for your patience
Thank you.
during this process.
County Attorney? No comments? Okay. BCC comments? Commissioner Weiss, any comments?
Yes, Mayor. Last year, Palm Beach County was successful in a state budget process, and we received and secured an appropriation of $2.75 million for Phase 1 of the downtown West Palm Beach signalization upgrades pilot program on Okeechobee Boulevard. It has been requested for the county to support an appropriation request for the second phase of funding for this project that the related group and their lobbying team will be working on during the 2025 session. So I'm asking for a motion to support a state appropriation request of up to $4.2 million for Phase 2 of this project.
Are you making the motion or asking?
I am
Okay, I'll
making that
second it.
Okay, did you get that? Okay. All in favor? Aye. All opposed? Oh, before I do that, I'm sorry. Commissioner Flores, you have I can see the light in your head on, so the light bulb is on.
You saw a perplexed face.
I did.
I'm in favor of this particular motion, but usually when things like this come up, I would like to have something in writing so that I can at least study it before taking the vote. That's a side comment. I am familiar with this particular topic, so I will be in favor.
Thank you. All in favor? Aye. All opposed? See, the motion carries 6-0. Anything else, Commissioner Weiss?
Not at this time.
Okay. Commissioner Woodward?
Thank you, Mayor. I would just, it's more of a question in my comments because we pulled 4 items, which probably would have kept us here till after midnight. Actually 5, because we postponed one. Are these all expected to come back at our next meeting, or?
A few of them will come back at zoning, and then the others will come back on the 11th if they're ready.
Okay. So because we can put agenda items on.
Yes, ma'am, you gave me that permission.
Thank you.
Thank you.
Sorry, and thank you, staff, everyone, for all the hard work today.
Thank
Commissioner
you.
Sachs?
Thank you, Madam Mayor. I'd like to do a proclamation declaring February 28th, 2025 as Family Promise of Southeast Florida Day.
Second.
Thank
I'm assuming it's an off-site?
Yes, offsite.
Thank you.
No, I'm not
We
doing that.
have a motion and a second. All in favor?
Thank you.
Aye. Any
Aye.
opposed? See that the motion carries 6-0.
Thank you. And then, many years ago, a Delray activist raised over $50,000 to fund the creation of a civic center. And at that time, a plaque was placed inside the civic center with his name on it. I'd like to put it on the outside.
Second.
Does that need a motion?
Third, yeah.
Okay. Yeah.
Thank you. And that's it. And
Okay.
thank you, staff. Thank you, everybody. Thank you, colleagues, really. I thought we had a healthy discussion today on a very difficult topic. And I just really enjoyed it. Thank you.
Thank you. Commissioner Flores?
Yeah, I just want to thank staff. I thought that they did an exceptional job. I want to thank everybody on the board. I mean, I must have had like 20 meetings with each of the applicants for the ambulance. So no, I just want to say thank you, because I feel like we all took this very serious, and at the end of the day, the biggest argument came to providing great care and service to our residents. So when we put that first and foremost, I think we're doing the right work. So thank you, staff, for everything that you did, your time, your effort. I appreciate it. And lastly, I just want to ask, and I have a feeling this was decided before I got on this board, the lunch breaks are an hour and a half. I would rather leave earlier than take an hour and a half lunch. Is that something that was decided a while back?
It's usually by the mayor's preference, and
Okay.
sometimes when I have commissioners say they'd like to schedule meetings during the lunch hour, I try to accommodate. Sometimes if we're going to, as a group, we're going to an event, I'll accommodate for that too. I agree with you, an hour and a half is long. So I mean, I could do a half an hour, but, I just try to accommodate everybody. But we do need to have a lunch break, and it is nice to say it in the beginning so that folks can plan accordingly for the rest of the day and staff can plan.
Agreed. All right, thank you.
Thank you. Vice Mayor.
Thank you, Mayor. I would like, without objection and with the support of my board, to formally request the Dr. Latipo to give a presentation to our board on water fluoridation, because there's been so much information out there. There's been so much back and forth on everything. I'd like to see if staff could reach out to his office and see if he couldn't come here and, give us a presentation.
Surgeon General for the state of Florida.
For the state.
Oh, Labada.
I can't ever say it correctly, so forgive me.
It's Lapato, but,
There-
and so, Vice Mayor, you were asking for, without objection, if we could,
Formally request him to come and, answer questions.
give
of
a
the
presentation to the board.
Right.
Anyone object to that?
I don't object, but I'd like to make sure that we also have, because I know there's two sides to this, that we also get the experts on the other side to talk about this.
A more expert than our Surgeon General? For the state?
Yes.
Okay.
I think, well, you know what, I think this is a broader discussion, and I do believe that we should get as much information as possible.
I don't disagree.
So I think that and I don't see we have any reservations from our
Happy to hear information.
I have a point, I have a question. And it's really also for the attorney. Do we have any authority over
It's a
water
request.
in the?
Oh.
We do. We have authority over water in the county.
Mm-hmm.
Our county water, we have authority over. So if by having this presentation, which is an idea, which is a good idea, information is good, could we then make decisions as to what is in county water?
We can, but I would recommend that you have meetings with staff and talk about this, privately before you begin a public discussion on this. It is a really hot topic. And I'm sure that at Water Utilities, we have some experts, and maybe at or it's Water Utilities. But I think that we really need to have some internal discussions before we start with the kind of meetings that we've seen other people have on this topic.
Point taken.
Well, if I could continue, I think that I hesitate on private meetings, number one. Number two, I think it is good and wise and prudent for us to have an open and transparent meeting. However, I think it's important that we have the right people here to give us advice. So with regard to that, I'll leave that up to my colleagues in terms of who to have here. But yeah, it is a hot topic, and maybe it is right for us to do it at a point in time when we can decide who will be giving us advice on that. So I absolutely second that. If it's a motion, I second that motion to have it.
Todd, you look like you would like to.
Yeah, if you like, staff can maybe put a proposal together for you in terms of who we think some of the people that you should hear from on this issue. I mean,
Todd,
can
we not turn this into 14 meetings?
No. We'll try to turn it into one. But what we're trying to do is that, this was a policy decision, like in our water, that was
Please
made by
bring our water people with this. But
Yeah.
do we need a whole discussion on who just to invite to the meeting?
No, I don't think we need a discussion. I said we can bring you a recommendation of some of the experts that we rely on from EPA, from the American, Medical
Okay.
Association, from the American Dental Association.
Expert will not be staff.
The studies
Let me
that have
be
been
clear
done.
on that. We're going to reach out to experts within the field that we relied on the last time this issue came up because it's cyclical. And our board did vote to put fluoride in the water. So we'll reach back out because it's a nationwide issue that people are talking about. So we'll work together. We'll give you that information, the individuals that we'll bring in, and we'll go from there.
Sounds good.
Thank you. Commissioner Woodward and the Commissioner Flores.
Thank you, Mayor. And thank you, Vice Mayor Baxter, for bringing this up. I have had a number of contacts too, and I think that we should discuss this. It's a hot topic, and I was surprised, and I guess a little happy to learn a city that I live in, my water isn't, and there's a mix of our cities that do or don't. So I would just ask that when you provide us with the experts to make sure that it's balanced so that we hear from, the pros and the cons on this, and that way we can make a very informed decision. And thank you for bringing it up.
Commissioner Flores.
I just wanted to echo what Commissioner Woodward just said. A panel would be great. That way we can make a determination. Thank you.
Thank you. Vice Mayor Baxter, any more comments?
No, thank you.
I have a couple.
Thank everyone.
Sorry. Okay, nothing has to do with water. I actually have I'm going to request 3 off-site proclamations. The first one is declaring March 2025 as Irish American Heritage Month.
So moved.
Second.
Okay. All right, wait.
Second?
Thank you. I've got a motion from Commissioner Woodward, a second from Commissioner Baxter. All in favor? Aye. All opposed? Motion carries 6-0. I would also like to request an off-site proclamation recognizing the 5th anniversary of the Andrea C. Cameron Foundation.
So moved. Second.
All in favor?
Aye.
See, the motion carries 6-0. Lastly, I would like to request an off-site proclamation recognizing the 50th anniversary of the Ferd and Gladys Alpert Jewish Family Service Center, and I know that Commissioner Weiss will be joining me on Sunday. Well, you make the motion.
I'll move that.
Okay.
I'll second it.
We have a motion. Okay. All in favor? All opposed? See that the motion carries 6-0. And the last thing I'd like to say is you all know that we are a sponsor with the Cognizant Classic in the Palm Beaches. And they have a Ladies' Day scheduled for our workshop day. I will be speaking. I would actually like to postpone our workshop because I also would like to invite the other commissioners to attend if they would like to. I think it's showing support of our local community. As you know, we are an underwriter, and so I would like to actually postpone so we can give the other commissioners an opportunity to join me.
Yeah, what day?
That is Tuesday, February 25th.
Add agenda is housing.
The housing will be on the zoning agenda because it's going to be workforce, but we're going to add some more things to it. But it will be on the zoning meeting.
So we really don't
for
have,
housing.
even have an
For
agenda?
the workshops was going to be public safety issue, behavioral health is in scheduled for March or April. So it's items that I can put on the 11th at our next regular schedule meeting. So we won't have to wait until the workshop because the March workshop, Todd, did you send out the memo to the board? The next day is Ledge Day, that Wednesday. So the Tuesday, normally the board travels on that Tuesday to Ledge Day. So we did send out a survey to find out who's going and whether we would have a quorum if we held the March workshop as well. So we'll get back with you on the March workshop. But
Should we vote on March at the same time?
No, we'll vote on March at our next meeting.
Okay.
And, because we'll know.
Yeah,
by
we'll
then.
have, we'll
have
know
some
whether we have a
information.
quorum or not.
So are we okay with not having the workshop on the 25th is my question?
Of this one?
Yes.
I say that I'm okay with it as long as we bring it up on the following meeting.
We'll bring it up. We'll bring both
Absolutely.
of those items back on the 11th.
Thank you. And I invite the rest of my commissioners to join us.
Wait, the workshop items will be done on the 11th?
Yes, we'll bring it back on the regular board
And
meeting.
what about all the ones we deleted from today?
Not all of them will be on the 11th.
When will they be?
We'll spread them out. Some of those were consent items. We just ran into needing to clarify, and there was some legal things on one of them. So they should be easy things to go through. The term sheet with related, I don't, that's not coming back on the 11th. We don't know when that's coming back, but we'll bring it back to you for the
But the
hotels.
11th is not the day before Ledge. The
No.
18th is the day before Ledge.
That is correct.
Okay, so.
But I think
But that agenda day is
but
going
that
to be.
commissioner is asking, am I going to have you here till 6 o'clock again? So the intent is not to. I think that some of those items will be easy to go through. They'll be on consent. But if that item comes back, it will not be, the terms will not be on consent.
But that was pulled. We had nothing to do with that, so.
Yeah.
Yeah. It is going to come back at some point.
The, so the workshop items will be agended for the March 11th BCC meeting. Will that be a BCC meeting and workshop?
And matters by the public?
We will,
And
we
matters
will,
by the public?
oh, that is a lot.
Yeah.
Do you want me to push it off
Can we,
to our next,
Is that also election day?
yeah.
Can we change the date?
It's not time sensitive,
I don't think so. I think
March
it's by-
11th.
by
those two
ordinance.
items?
That's also
Okay.
election day?
March 11th?
And do you guys have to go to?
Then we will, let me do this. For those that are time sensitive, I will put them on the 11th. For those that are not, we'll put them on the next available date.
Which could also be a zoning or a
That is
planning
correct.
meeting too. It
That is
doesn't have to be,
correct.
okay.
That is correct.
If I may? I just really want to have this mental health discussion, and I don't want it to be rushed.
Okay.
So to me, that's something important, something I've been harping on, looking forward to this mental health discussion. So I just want to make sure that we do it justice and we're not rushing it. And when I hear that we have matters by the public, there is elections.
BCC, yeah.
Okay.
I don't know what it entails for me for canvassing board. I just want to make sure that.
So our items that were on for
The golf thing?
this month's workshop was reentry update, and it was an update, and then the animal care and control overview. Those were the two items on for this month's workshop. So we'll schedule them and give them the appropriate time wherever I need to place them.
Mental health is not on this workshop.
Mental health is not on the February workshop.
Okay, let's get
Mental
straight what
health-
was supposed to be on February.
I'm sorry?
Let's get straight what's supposed to be on February, because the mental health was not scheduled
It was
for
not.
February.
Youth reentry program and update, so we can tell the board what's going on with the program. And then animal care and control overview was scheduled for this month's workshop. The behavioral health, because we've added on a lot of things, it was slated for March, but it's so many people now that we're kind of balancing. So it would have, even if we kept the March 18th workshop, we would have been looking to put it at April or May, because it's so many people after the board said to add a number of the other partners and other folks. It's taking time to kind of get everybody together. But when we schedule it, it will be top of mind, and we will schedule it so that you have plenty of time to discuss it.
But again, that is not on the February. So
No,
the
it's
the
not.
February workshop is a relatively quiet workshop.
That is
why,
correct.
that is the only reason I would ask for this.
No, no,
But I
that-
also would like if the other commissioners would like to attend, it would be, we are a sponsor of the Cognizant Classic in the Palm Beaches, so, any support would be great.
If I could, because we have zoning 2 days later than this, the workshop. We have zoning on the 27th, so could some of the workshop be pushed to that zoning? And that would
Absolutely.
just take care of it, and we wouldn't be pushing it into March.
Yeah,
Because
but
the March 11th, that's going to be a meeting, and it's election
Well,
day.
now, you mean the February zoning?
Yeah, February 27th is zoning.
Please allow me to look at the schedule, because we're already putting things on that particular agenda, and you've got some other issues on that agenda you're going to need to address. So we don't want to add to it. So we know that these things are important, so we will bring them back in the appropriate time frame.
Okay, so we're in consensus then that the February 28th meeting is being canceled. I do hope that, the 25th, sorry. I do hope that my fellow commissioners, actually, it's Women's Day, so my fellow female commissioners, the men can come if they like, but
They'll be in
it
the
is an
back.
all-day event, and if anyone wants to join, please let me know. But I do thank you, and it is 5:54, and it's been a long day, and thank you all for being here, and thanks, staff. It's been a challenge today, but we do appreciate it. Thank you, and have a good night.
So when I got sworn in, they